Just a couple hours. I hate to say that because don't be scared. It's going to be good. It's going to fly by. But just a little bit of your time to learn more about what God has actually already done for us. And I just know what you learned tonight is going to leave a lasting impression. So some housekeeping stuff. I want to just tell you there's some emails list on the back. If you like what you hear tonight and you want to be plugged in with more events we're going to be having, please put your name down and your email address. It's not going to commit you to anything, but it just gives us a way to keep track of who's interested and who's not. So feel free to do that. And then also we just want to thank Fourth and Elm for opening up the doors and joining us in our journey to living healthier. So thank you, Michael Harbor, our preacher, and the elders in our congregation. And here's Brittany.
Okay, so Dr. Edwards was born and raised in Belton, Texas. With both grandfathers being physicians, he always knew he wanted to be a family doctor. He received an undergraduate degree from Baylor University and graduated from UT Houston Medical School. While practicing at the Garza County Family Health Clinic in Post, Texas, Dr. Edwards became interested in and eventually transitioned into integrative medicine. He is here to share about his belief that the body is designed perfectly and knows how to heal itself if given the opportunity. Please help me welcome our guest, Dr. Ben Edwards. Did he go? I think he's upstairs. Yeah, he'll be right here. Zip line. Oh, the zip line. I don't know.
In the meantime, I could have my daughter come and sing to you because she wants this microphone really bad. Just out of curiosity, I know we have a lot of Sweetwater, Merkel, Rotan, Colorado City. Who else is in the auditorium today that I have not mentioned from? Silver? Okay, where's that at? Okay, Silver. Anybody else? Mary Neal. Okay, thank you. I like that, this, obviously, if we do this on the internet, it reaches a lot more people, but then we also have an opportunity just to fellowship with other Christians on the same journey. I bet a bunch of people in here are suffering and, physical, mental, whatever ailments you are going through or struggles. So just reach out to one another and let us love on you. So anybody else? For here he comes, because I'm not the main speaker, thank goodness. All right, Ben Edwards.
Did good, thank you. All right, thank y'all for your patience. I'm not very technologically inclined, so I've got this fancy iPad Pro that hooks up to y'all's system, and it's working now, so thank you for your patience. Can y'all hear me okay? Okay. No? Better? Testing, 1, 2, okay. Sometimes I get soft-spoken, so I'll try to keep it loud, keep y'all awake. Heidi, thank you for the introduction, and Brittany, thank you for the introduction. I'm happy to be here tonight. This is really what I love doing, going and talking to people. Once I got on this new natural medicine path, it really takes a hold in your heart because you realize this is really the truth. And when the Lord convicts you of something, you want to share that message, and so that's why I'm here to do that. Tonight, my talk is called An Introduction to Functional Medicine. Now, for you husbands out there who your wives drug you here to talk about nutrition and be healthy and all that, don't worry. We're going to keep it interesting, hopefully, for you, so you won't fall asleep. Functional medicine, that's probably a new term for most of you because it's not in West Texas yet, except for our clinic at Veritas Medical, which, another disclaimer, I'm not here to sell anything. I'm not here to even try to talk you into be my patient. And in fact, my goal is to talk me out of a job. I think your body's designed so beautifully by God that it can fix itself, and you don't need a doctor. Poor stewardship has caused us to need doctors, but I really believe if you steward your health properly, you won't need me or any other doctor. So I'm really not here to drum up business. I'm here to spread a message because I think it needs to be spread because not enough people know it. And the truth will set you free, I read somewhere. All right, functional medicine. I think functional medicine started about 2,000 years ago with this guy, Hippocrates. Let food be thy medicine. I'm sure you all have heard that. About 100 years ago, this guy, this is Sir William Osler. He's considered one of the founders of modern medicine. He is one of the founders of Johns Hopkins University and the hospital there. So this is kind of one of the gurus of medicine that you learn about as a medical student. Here's what he had to say. One of the first duties of the physician is to educate the masses, not to take medications, which the Latin root of doctor is teacher. I found that out when I started on this journey too. I thought, well, how appropriate, because mostly what we do in our visits now is teach. Here's Thomas Edison in 1902. He said, the doctor of the future will instruct his patient how to care for the human frame and how to diet himself instead of giving medicines. That was over 100 years ago. This is Dr. Mark Hyman. Currently, Dr. Hyman is the head of the Institute of Functional Medicine. The Cleveland Clinic has a wing dedicated to functional medicine. And recently on a radio interview, Dr. Hyman said he believes every doctor 20 years from now will be practicing this way. I think he's probably a little bit inaccurate. I think it's going to take a little longer. The system that we're in takes a long time to change, but I hope so. This is another quote I love. It's from the same Dr. Mark Hyman. This is before Cleveland Clinic, and he signed an agreement. Cleveland Clinic pursued Dr. Hyman for a couple of years, and Toby Cosgrove is the CEO of Cleveland Clinic. And in his pursuit of Mark Hyman, this is what Mark Hyman told him. Toby, you don't want me there, because if I go there, I'm going to tell you that most of what you're doing is wrong, that in fact you're harming people, and that I would want to implement programs that are going to empty out half your hospitals, clear out most of your procedure rooms, reduce hospital stays and doctor visits dramatically. Are you okay with that? And to Dr. Cosgrove's credit, he was okay with that. And he pursued Mark Hyman. They made the agreement, and that was 2 years ago. So this is a growing trend in medicine, definitely on the East Coast, kind of getting into the Midwest, and it's here a little bit. But it's growing rapidly, primarily because of the results that patients see. So a lot of this sounds like crazy talk, and I'm going to say some crazy stuff tonight, like which one of these do you think I'm going to tell you is healthier, the skim milk Wheaties and whole wheat toast or the bacon and eggs? And I'd much rather eat the bacon and eggs, and we'll go into that later tonight as to why that is. So a lot of this healthy eating we've been taught the last 50 years, low fat and diet everything and use artificial sweeteners, turns out to not be the best way to go. Here's another crazy thing I'm going to talk about. The countries that drink the most milk have the most osteoporosis. I'm also going to talk about how eating fat does not make you fat. Cholesterol does not cause heart attacks, and heartburn is not from too much stomach acid, even though the TV commercial tells you it is. Now that's crazy, probably you're thinking, because that's directly opposite of what conventional thinking has been your whole life, probably. So before we get into all this crazy talk, I have to convince you I'm not crazy. This is my family. And somebody told me one day, Doc, you're trying to convince me you're not crazy and you have 5 kids? So I might have to take that slide out or just make it me and my wife. But I'm kidding. Those are our kids and they're a blessing. My wife, Jamie, is from Turkey, Texas, and Colorado both, but small town farm girl. So she knows about bacon and eggs and biscuits and gravy. And I tell the funny story when I married Jamie, I was going into my 3rd year of medical school at UT Houston. And she moved down from WT where she was in college, and she didn't know a soul in Houston, Texas, and it was a big city, and I was at the hospital all the time. But one of the first dinners that she made me, I was studying in our 2nd bedroom, and she called me to the dinner table, and I came out of that bedroom through the door, and I could see the kitchen table over there. and she had made chili and cornbread, and from way across the room I could see there was this thick layer of white on top of that cornbread, and I thought, who did I marry? They put icing on their cornbread? And then I got over there and she said, no, that's butter. And it was a lot of butter. And I mean, I kind of scolded her. I said, babe, we can't be eating like this. My granddad had a bypass surgery when he was 65. I can't be eating butter. We got to eat I can't believe it's not butter or Smart Balance or one of those things. And she drank whole milk and I drank skim milk. And all those years I hounded her and she started to convert. And now I've got to repent to her. But this is the day of my graduation from medical school. Those are both my granddads that Brittany alluded to. I grew up in Belton, Texas, watching these two guys do everything. If you needed a baby delivered, they delivered your baby. Usually they'd do that at home. They'd amputate your leg if need be. They'd take out your gallbladder. They would take care of the newborn to the nursing home, everything in between. So that's what I grew up knowing a doctor was, watching those two guys. So UT Houston, went undergrad at Baylor, and then UT Houston Medical School. It's a great medical school, big Texas Medical Center there. MD Anderson, got to do some rotations there, so I got to learn from some really good, smart doctors. Dr. Red Duke, y'all remember him from the University of Texas Health Science there in Houston, Texas. Dr. Red Duke, he was still there when I was there teaching surgery. So great school, learned a lot. After med school, you do residency. Went to Waco Family Practice to do residency. Was a chief resident there, not because I was the smartest guy in the class, but because I was kind of the peacemaker, get along, nice guy, pretty much. Dr. Aker can testify. Went to residency with Dr. Aker, and actually he's really the reason I'm here tonight. He probably doesn't remember, or he may remember. After Waco, I ended up in Post, Texas. My wife and I, since she was from Turkey, I knew we wanted to look kind of in this general area for a small town. And we would take off on the weekends and just drive and end up in a small town somewhere, Haskell or Knox City or Childress or wherever. And we went to probably 30 different small towns, and we'd walk into the ER and ask the nurse, what's the doctor situation here? Do you need another one? And pretty much every town needed another doctor, but they all had at least one at these hospitals, but Garza County didn't have any, and Robert's the one that told me, you need to look at Post because they don't have a doctor. And I kept thinking, well, they don't have a hospital either, and I love delivering babies because bringing life into the world is, joyous and happy, and that's a good side of medicine, and the rest of medicine's sick and death and dying. And they didn't have a hospital. I thought, well, that can't be the place for us, but Jamie and I kept praying about it, and that's where the Lord said we needed to go, so we went. And when we got there, they were the old clinic there wasn't in real good shape, and from the plumbing to the air conditioning to just everything. But the town got behind me, and the hospital board got behind me, and they agreed to build a new clinic if we were successful and could make some money for them. And so we had a really good office manager, a good nurse, good community support, and we did good. And so that clinic grew from a $10,000 a month deficit to making money. So the town was happy, and the board was happy, and I was happy, and they built the new clinic. When you drive through Post on 84 by the rodeo grounds on the other side of the highway, you'll see the brand new clinic there. And so I got to design that clinic just the way I wanted it, and I didn't have to pay a dime because the county built it. A year after we opened the doors to that clinic, the $1.2 million bank note was paid off. A year after that, $1 million in the bank because the tax money was coming in, but they weren't having to pay out because we were making money. I mean, we were successful. We were sustaining ourselves. And the way you make money in a small town clinic is to see a lot of patients. That's just the way the system is. I averaged about 7 minutes per visit. You just crank through them like cattle, 40 patients a day. And you do lots of procedures. If you can do something with your hands, that's how you make money. So if you can pick earwax out or set a broken bone or do sutures or cut off a wart, you get paid a lot more. So in a small town, you don't have to refer to the dermatologist to do all that, or you do as much as you can. That's how you make money, to be honest. So we did. And I was raising my family in this small town like I wanted to do, following my granddad's footsteps, living the dream. So everything's going great. I mean, we're in the 90th percentile of the MGMA. That's Medical Group Management Association. That's the business side of medicine. They come in and look at your numbers. How many procedures, how many office visits, your collections, your everything on the business side. And we were in the top 90th percentile of the country. So we got a little bit of press. Texas Monthly came and did an article on small town doctoring in Post, Texas. Then the Washington Post came and did this article. I don't know how they decided to come to Post, Texas, but they did. And they followed me around for a week, and that's me making a house call on a patient. And they put us on the front page. And now I'm not saying all this to boast. I know I'm sounding kind of prideful here, but I'm setting the stage because I want y'all to understand where I was at. Fame, fortune, money in the bank, good quarterly bonus check every quarter, living my dream in a small town. Your doctor, you're kind of up next to God, and you can get a little prideful too. Friday night football games, the nursing home, the county jail, you do it all, and people put you on a pedestal. And I'm living my dream, like I said. So everything's going great, perfect, except there was just one problem. And that was that the patients weren't really getting better. And what I mean by that is Mr. Smith would come in with high blood pressure, and I'd write a prescription for lisinopril or hydrochlorothiazide, and I'd give it to him, and he would take it, and his numbers would come down. And that's good. But, next year when he came back in for his refill, his pressures would be a little bit up. Well, no problem. We'll just give you a higher dose. There you go. See ya. That's an easy one. Next patient. But year after year after year, you're just adding a little higher dosage. Or, this year your sugar's up a little bit. Let me write you a prescription for metformin. Oh, now you got heartburn. And pretty soon you're on 3 or 4 meds or 5 or 6 or 12. But everybody's just on this trend of not getting well. But in my heart, I'm doing what I'm trained to do. This is what you do. Someone has high sugar, you give them metformin. They have high blood pressure, you give them this medicine. It's just, that's what you do. So I don't know what to do about it. It just kind of bugged me a little bit, especially when it was the kids. Dr. Aker and I were talking over supper about some of the kids even here in Sweetwater, high blood pressure. And that's what I was seeing in Post. I diagnosed a 7-year-old with type 2 diabetes. That's adult diabetes. He was 7 years old. Every year, the football physicals at the school, the blood pressures are creeping up every year, getting heftier and heftier, the cholesterol is going up. Even kids are getting sick. But again, I didn't know what to do about it. And it wasn't just Post, Texas. Looking at some of these statistics from nationwide statistics, this is in America today. 1 out of 2 men, 1 out of 3 women will be diagnosed with cancer in our lifetime. This is your diabetes rates from 1981 to 2011, quadrupled. Death from senile dementia from 1979 up to 2009, you can see the trend. This is from 2010 till 2050, the projections for Alzheimer's. Here's out of the CDC. They announced a few years back, they published a study that showed the kids that were born after the year 2000 will be the first generation of children not to outlive their parents' lifespan. First time since the American Revolution that our lifespan on the kids took a downturn, and they won't live as long as their parents did. America ranks 26 in life expectancy of all the developed countries. We're dying younger. Infant mortality rate is higher than other countries. So our babies die more often. Here's some autoimmune diseases: multiple sclerosis, Crohn's, type 1 diabetes, asthma. This is you can see the trend from 1960 up to 2000. Everything's on an upward trend. And I'm not trying to be real depressing here. We'll get to the good news in a minute. Autoimmune disease. 1 in 9 women today have autoimmune, and that's climbing. It's the 8th largest cause of death, 4th largest cause of disability. You're 8 times more likely, women, to have autoimmune than you are to have breast cancer. Here's kidney and renal pelvis. That's kidney cancers, climbing from 1975 to 2009. Here's your deaths from thyroid cancer from 79 till 2009. They're climbing. Here's celiac disease, climbing. Here is acute renal failure. You get the picture here. Well, I could pick any disease. Here's autism, 1975, 1 out of 5,000. This was 2009 at 1 in 110. I think it's 1 in 88 now. Here's some statistics on The number of different MRIs and CAT scans and tonsillectomies, if you look in the column there of ranking, second, third, first, third, I mean, we're in the top 1 or 2 or 3 of doing all these scans. So we're doing lots of procedures, lots of bypasses and knee replacements and other things. Here's different countries with the number of prescription drugs taken daily, age 18 and older. This is back from 2013. The U.S. down on the far column, number 1. Here is our spending, healthcare spending. We outpace everybody else. Let me change something real quick here because I want to draw. All right. Oops. Bear with me. There's supposed to be a little laser pointer I can use on this, but it's not working. Anyways, this is a busy slide. What I really wanted to point out, the United States at the bottom, 6.1 on the second column, that's the infant mortality. If you go up and down that column, 6.1 is the highest number. 78.8, that's the life expectancy. If you go up and down that first column, that's the youngest number compared to all the other countries. So you go across the board, chronic diseases, obesity. Basically what I'm trying to get across here, excuse me, we go spend a lot of money, obviously, on healthcare. We do lots of procedures. Lots of medications are prescribed. So we're number 1 in going to the doctor and taking meds and doing lots of stuff. But our outcomes are at the bottom. So what other industry, what other school district, if your coach at the high school spent the most money and had the worst results every year, you're probably going to fire him. If you're in the business world, same thing. If your budget's the highest, but your production's the worst in your business, you're not going to make it. But in the healthcare industry, we kind of no one really points this out or knows what to do about it. We kind of are pointing it out now because people are going bankrupt. The number 1 cause of personal bankruptcy in America is a major medical catastrophe. But now businesses are starting to face the same thing. I talk to businessmen all the time. They're being forced with making a decision to not carry health care insurance or carry very minimal because the rates are going up so high. Aetna just pulled out recently. Blue Cross Blue Shield announced in Texas they're going up 60%. So, it's all coming to a head. And the problem is we're not fixing anybody. We're chronically managing your disease. What I mean by that is, here's a good example. My wife's Suburban the other day had a slow leak in the tire, real slow. So the air just went out real slowly, but about the 5th day, it was flat enough. We need to fill it up. And so I took it to the filling station, filled it with air, and she kept going, and she was fine. Got the kids to school, got to the grocery store, did what she needed to do. She was okay. But by that 4th or 5th day, it had leaked down enough again. It needed more air. So I went and aired it up again. And I did that like 5 or 6 times before I finally just said, enough of this, let's fix it. That's what I'm talking about. I was managing the problem, and I was too busy to fix it. So management of that tire, we were getting by. It was working, but probably it wasn't good for the life of the tire. Slowly going down. I'm sure it did some wear and tear on the tire. Maybe the alignment or the shocks and struts and all that probably maybe increased her risk of a blowout or a rollover. There are consequences to just managing the problem and a quick fix as opposed to fixing the problem. So anyways, that's the scenario. That's where I came from. I like to paint that picture of where I was at so you understand, how in the world could he do what he's doing now? Because first of all, no one knows what we do, and they're always asking, what in the world are you doing? This all natural, holistic, what is it? And, people, you're in West Texas, you do something different. It's a little bit risky. So I like to give that lead up to why I made the switch. So what it came down to was this divine appointment. The Lord arranged a divine appointment with an integrative doctor. Integrative means you just will integrate your modalities. You'll use acupuncture, you use whatever works. It doesn't matter if you didn't learn it in med school. If it works in Germany and it's proven to work, then he may use it here. So I met this integrative doctor on a divine arrangement from the Lord. And what this guy told me was shocking. And I didn't believe him, just like you're probably not believing this. He said there's no such thing as diseases. And I said, what are you talking about? There's diabetes, hypertension, coronary artery disease, blah. I just went through it. There's 2,000 diseases, and I just learned them all in med school, and I treat them every day, 40 patients a day. I know there's diseases. And he said, nope, They're all consequences. And if you weren't born with it, then something happened along the way that caused it. And you need to just be a CSI detective a little bit better than you are and figure that thing out. Thank you. So, I mean, it sort of kind of resonated with me. Okay, yeah, I guess so. There could be a root cause to stuff. But then immediately, well, if that was true, why didn't I learn it at MD Anderson in the Texas Medical Center? And all these really smart doctors above me, they would have taught me that, right? And then he said, well, I already told you that if you weren't born with it, it's reversible. So he intrigued me a little bit, but not enough to, I was busy. I was raising my kids. I had my good life in post. But he kept kind of hounding me a little bit. And he said, you know what? I'll prove it to you. Send me your 10 sickest patients. And I said, okay, I'll consider that. And doctors have really tough, sick patients that they kind of a little bit cringe. I'm going to give away a little bit here, but not on the outside because we love y'all and we're polite. But when a fibromyalgia patient would walk in, or irritable bowel syndrome, or some of these tough chronic fatigue, depression, you kind of don't know what to do with them. I mean, there's medicines, but they don't work that good, and these patients just keep coming back. So I gathered up some of my toughest patients, my chronic fatigue, fibromyalgia, my worst diabetic who was on 4 diabetes pills and a bunch of other pills too, but he didn't want to go on insulin. He was refusing insulin. His blood sugar's 300, and he's just telling me, no, I'm not going to do insulin. I grabbed him and said, hey, there's this guy. I don't know anything about him, but you're desperate. I'm desperate. Maybe. A chronic prostatitis, this guy with a prostate infection for a year. And I'd given him tons of antibiotics, and the urologist had given him tons of antibiotics, and this guy could not get better. Had a lady with chronic urticaria. That's where these hives pop up, and you just scratch and scratch and scratch. And she would scratch herself at night in her sleep until she bled, and for over a year. And of course, that was out of my league. I'd given her antihistamine, steroid shots, sent her to a dermatologist, sent her to another dermatologist, sent her to an allergist. Did everything for this lady. Didn't work. So those kind of patients I gathered up, and I told them, hey guys, y'all are desperate. I know you're desperate. You've been to the specialist. There's no hope. Here's this guy. He's telling me this stuff. I don't know. Well, they went. Those 10 people went. All 10 of those patients came back better. Way better. Most of them all the way better. The lady with the rash, the itchy rash, totally fine in about 4 weeks. In about 8 weeks, the diabetic on 4 pills was off all his diabetes pills, on half of 1 blood pressure pill. He had been on 3, and a cholesterol pill, and 2 reflux pills. He was off all of it except for half of 1 blood pressure pill. And his blood sugar was normal. Same with the chronic prostatitis, same with the fibromyalgia. It blew me away. So I got on the phone to that doctor and said, all right, I need to know what's going on here. Because bottom line, all of us go to med school to help people. And when you see people that you couldn't help for 7 years, I was these folks' doctor, and I'd send them to other doctors, and they couldn't get better, and they got better. That kind of obligates me to figure out, what's up here. So I called the doctor, and he said, he started telling me all this stuff and sending me journal articles and books to read, and just told me go to this conference, go to that conference. And then he said, type 2 diabetes, totally reversible. He said, how do you get a drunk person quit being drunk? And quit drinking. How do you get a diabetic quit being diabetic? You quit eating sugar. And I'm like, man, it can't be that simple. So he said, well, just Google Gabriel Cousins, MD, reverses type 2 diabetes. So I went home that night, Googled that, got on YouTube, watched Gabriel Cousins' videos, and read his stuff on his website. And I was up till 3 in the morning. This guy was reversing type 2 diabetes. And my wife was saying, Ben, come to bed. It's 3 in the morning. And I said, Jane, this guy's reversing type 2 diabetes. Do you know what this means? Because if you have type 2 diabetes, you increase your risk for heart attack, stroke, Alzheimer's, cancer, everything. So if you really reverse that thing, you just totally change this person's whole risk ratio. That blew me away, and I thought, even if this only works 10% of the time, it's worth it. Because half my patients in post are diabetic, and the other half are going to be diabetic if I just give them long enough. So that, for me, sealed the deal. If all I did was focus on diabetes and really get that nailed down, I was in. So I was pumped up now because he was talking diabetes. But I was busy doing my thing, 40 patients a day and trying to learn this stuff on the side. And so I called that guy up and I said, I'm kind of busy here. Can't you just send me one summary article or book to read that summarizes all this alternative medicine? And I thought was coming through the phone at me, said, alternative? What do you mean alternative? I said, well, this kind of weird hocus pocus, all holistic alternative stuff. And he said, Ben, the next time you're going to hop on an airplane to go to a conference, are you going to go with the aviation guys or the alternative aviation guys? He said, next time your car's making a weird noise under the hood, you're going to go to the mechanic or the alternative mechanic. Next time you need an addition to your clinic, you're going to call the engineer or the alternative engineer. And his point was, there are natural laws God put into the earth we all have to follow whether we like it or not. And like the law of gravity, all airplane pilots have to follow the same law of aerodynamics and the law of gravity. All mechanics have to follow the same law of internal combustion engines. There's just truth that there is, and it's how things function, and you can learn that and get in line with that or not. He said, there's nothing alternative. It's just the truth. And so he kept just saying these things, like poking at me, that made sense to me. But I still had nowhere to put it. How could this be true? It can't be true. There's no way. If this was true, these good doctors would have taught me this. So that's where I was at. But bottom line, it was my own patients who got better, and it convinced me this is the way to go. So we went. And I knew I was in for trouble because with these kind of visits, it's 2 hours. 1 to 2 hours you have to spend with the patient. And in my clinic and post, you get 7 minutes. And I was really good at 7-minute visits. But what it came down to was I told my office manager, if someone comes in with high blood pressure or diabetes or reflux or whatever, and they ask me about what I've been learning, and they initiate it, and they want to go this route, I'm going to do it. So give them an hour visit if they ask for it. And I knew what that meant. It meant I was going to get in big trouble because our money was going to go down the tubes. So I went to the board and I told them the same thing. Guys, I'm sorry, this is what I'm learning. It's really good. It's the truth, and I'm going to do it. But we're going to lose a lot of money. So go find another doctor to run them through like cattle, and I'll sit over here if people want to and do this with them. And they said, okay, we'll do that, and ended up it just couldn't work. I won't get into those details, but the Lord closed that door, and he opened another one. And that was 4 years ago. Now I'm at Veritas Medical that I founded. Veritas is Latin for truth. My wife and I were laying in bed one night, and I was saying, man, Jamie, this is just truth. It's bottom line is what this is. It's just the truth. And what's Latin for truth? And it was Veritas. So Veritas Medical was born one night laying in bed with my wife after going through all this. So we're going to get into some of this now. I like to teach, so let's get into teaching. All disease begins in the gut, Hippocrates said 2,000 years ago. I don't know how he knew it then, but he did. This is one of the first books I read, Why Stomach Acid is Good for You, Jonathan Wright. One of those patients early on, that integrative doctor saw had bad reflux, had it for years. And in a few weeks, didn't have it anymore. And I said, what in the world did you do? He said, just read the book. And then do what it says. And then maybe go to his conference. So that was the first conference I went to, Jonathan Wright. And I read that book. And first patient, once you know it, the Lord arranged when I got home, was a good friend of mine in Post who 7 years before, when I first moved to Post, came to me with reflux, 7 years before. And he had been taking Zantac over the counter, but he came to me back then because it wasn't working anymore. No problem. Prilosec, prescription handed to him out the door, good to go. Next patient, that was a quick 2-minute visit. All right. And it worked. Prilosec worked great for about a year, and then he came back because it quit working. No problem. We'll go to Nexium, a little bit stronger. Wrote him a prescription out the door. He was happy. It was working. His heartburn was gone. About a year later, it quit working. Okay, we'll just double it. So we put him on Nexium morning and night. That worked for a couple of years. He was good, and then he came back. It quit working. So I said, okay, let's do Zantac and Nexium. So we did double therapy, and it quit working. So at the end of 7 years, I had this guy on Carafate, Nexium, and Zantac, 3 different medicines, morning and night. And then he came back again. And I said, I don't know what else to do. You're going to the gastroenterologist. So we sent him to Lubbock to the specialist, and he came back real happy on a brand new medicine called Dexilant. At the time, I didn't know what it was because it was brand new, but it was the most high-powered, biggest bazooka proton pump inhibitor, anti-acid known to man. And it worked for a little bit, and then it quit. So this is who came into my office the day after this conference with Jonathan Wright. And I said, Jeff, I hate to tell you this, buddy, but I think we've been doing the exact opposite thing that we should be doing. And I think we need to stop all those medicines and actually increase your stomach acid level. And of course, he looked at me a little bit like I was crazy, but he was desperate. And that's the real reason I'm here tonight. I don't want y'all to have to end up at my office or another office like mine because you're desperate, because you've exhausted every option and the doctors have thrown their hands up, don't know what else to do. Because that's 98% of who we see. And it's a shame. And I don't want that to happen. So, but most people aren't motivated enough to make these changes until they are that sick. So I'm here to motivate you to learn this stuff, because once you learn it, knowledge is power. My people die or from lack of knowledge, I think, in Hosea. So let's get into this a little bit. Hopefully this pen will work now, because I need to draw. Here we go, the draw button. All right. So I'm not an artist. Bear with me. Is that showing up? Yeah. Okay. That's your stomach and your esophagus. And then down here, your small intestine. Now, there's a valve right here called the lower esophageal sphincter. See, anatomy is not that hard. This is your esophagus here. That's your lower esophagus, and that's a sphincter. So lower esophageal sphincter, LES. And then there's another one down here, a valve down there. Okay, so you need to know this. Normal pH, if y'all remember pH back in high school, was a scale from 0 to 14. 0 is, or 1, way down here, that's real acidic, like battery acid. And then, way up here is basic, like baking soda. So normal for the human body inside your stomach, when you're trying to digest that steak into steak soup, you're looking at a pH of about 2.0, way down here. That's super duper acidic. That's more acidic than battery acid. Basically, it's humanly impossible to make too much stomach acid. There's one syndrome that's very, very rare where you can secrete too much. I've never even seen it. Super rare. Other than that, it's humanly impossible to get really more acidic than what's normal. This is normal. This is my 5 kids. If you scoped them tonight and measured their stomach pH, it should be a 2. It's designed that way by our Creator. This is an amazingly designed piece of machinery right here that God did. So that's normal, 2.0. So real quick on stomach acid, you got to understand there's 2 main jobs. Number 1, digest. Like I said, turn the steak into steak soup. Yeah, it starts with your teeth and your saliva, but that stomach acid really gets after and starts breaking this food down. Number 2, everybody forgets this one, kill germs. Hydrochloric acid is a great germ killer. It's why God put it in the stomach, because every bite of food you swallowed tonight had bugs on it, had germs, critters. All the food in your refrigerator tonight has mold on it. You don't see it. It's not overgrown to the naked eye unless your raspberries are 5 days old, and then you will see it because those get moldy so fast. But to prove this, if you don't believe me, go home tonight, duct tape your refrigerator shut and unplug it. Go back in 5 days, open it up, and there will be mold everywhere. How to get in there? It was duct tape shut. The mold's already there, and so are other bugs. But it's no problem. You swallow the food, the stomach acid kills it. When my wife hears this talk, she always says, Ben, you're kind of Debbie Downer. There's bugs everywhere, and you're eating them. But the point is, there's stomach acid, and it kills them, okay? And, a lot of these viruses are called enteroviruses. They enter through the GI tract. Polio is an enterovirus. There's studies that show people with enough stomach acid kill the polio virus. They don't have symptoms from it. And there's lots of viruses that enter that way. So stomach acid is really important for those 2 reasons. You get your stomach acid from here. These little, I call them acid pumps. They secrete your hydrochloric acid. So much so that you stay there. Okay, so that's normal. That's how it's supposed to work. So when someone has heartburn, reflux, indigestion, it's because the acid's up here in the esophagus. That's a big problem. You will obviously hurt. And the cells that line your esophagus here are not designed to be exposed to acid. So if you always expose the cells in your esophagus to acid, you'll increase your risk for esophageal cancer. Barrett's esophagus, yes, some of y'all might have heard of. So that's a big problem. And this isn't normal. You shouldn't ever have acid up there. But as y'all can see, common sense would tell you must be a valve issue, because it's not a too much stomach acid issue. You can't have too much stomach acid. It's a location issue, right? You don't have to be the smartest doctor in the room. So the location's a problem. What's the deal with the valve? That's the whole question. Why is your valve not working right? That's a question we should ask. Figure it out. Fix the valve. You're done. So here's a little bit on why that valve doesn't work right. There's lots of different mechanisms. I'm just going to go through a couple. Here's one of them. There's receptors that line the top of the stomach. Receptors are like keyholes. There's keys that go into the keyhole. When that connection is made, you can do something. Well, these are receptors or keyholes for hydrochloric acid. When you have enough acid filling up enough of these receptors, then a signal, when you make a connection there, then a signal is sent via a nerve to the muscle that lines that sphincter to squeeze. If you have enough stomach acid filling up all the receptors, you get that signal to squeeze. If you don't have enough stomach acid, obviously, those receptors aren't filled up as much, and you don't get as hard of a squeeze. And that valve's just a pressure valve. So if there's more pressure below than there is from the top, you're popping your valve open. And here's how pressure develops in the stomach. When these acid pumps get turned off, the two top things in my patients that I see that turn off the stomach acid pumps, number one, it's a high sugar diet. 50% of your pumps turn off in a high glycemic or high sugar diet. The average American consumes a pound of sugar every 3 days. 100 years ago, your great-grandparents, it took them 12 months to get through 1 pound of sugar, and we're getting through it in 3 days because they add it to everything. Go home tonight, look in your pantry, and flip over your ketchup bottle, your spaghetti sauce, your Lay's potato chips, your Gatorade, whatever is in your pantry, there's sugar in it, almost guaranteed. It may be labeled. Go home and Google code names for sugar, and 30 different names will pop up. Most of them end in OSE, but it's in there. But a high sugar diet turns those pumps off. Number two is stress. When you are stressed, when you're in fight or flight mode, these acid pumps, 40% of these pumps turn off, because when you're in fight or flight, God designed this, stress mode. You're walking down the trail and a bear jumps out in front of you, you go into fight or flight because you got to kill that bear or run away from him. But you should kill it or run away from him in 5 or 10 minutes and be done, and not see another bear for 6 months, and you're good. So it's supposed to be a momentary thing that turns on and then turns off. Because when you're about to kill a bear or need to kill a bear or run away from it, you don't care about digesting your last meal. So your digestive tract really it goes down. Everything gets shut down quite a bit. Your blood gets shunted out of the gut into your periphery for your muscles to run or fight. Your pupils dilate, your heart rate goes up, you're ready to go. You're fight or flight mode. You're tense, your muscles are tense. That's fight or flight, or sympathetic dominance, we call it. Your nervous system is divided parasympathetic or sympathetic. Sympathetic's fight or flight, parasympathetic, rest and digest, or peace. So when you're in fight or flight mode, most of our patients are in fight or flight all day long. Family stress, spouse stress, financial stress, business, at the job, whatever. And turn on the TV, 24/7 news cycle stress. It's just stress out the wazoo. Stomach acid pumps shut off. So if you don't have enough stomach acid, then you're not doing what? The two things I taught you over here. You're not digesting your food. You're not killing germs. So what you have sitting at the bottom of your stomach here is food that's not being fully digested and germs that aren't being fully killed. Those germs ferment that food. That fermentation process creates methane and hydrogen, H2, hydrogen gas. This gas bloats the stomach. That pressure, intra-abdominal pressure goes up, and it pops the valve open. Number three, the valve down here, the trigger for your lower valve to open and let the food out and relieve that pressure, the trigger for that is stomach chyme. That's the soupy digested stuff. The stomach chyme pH has to be about 2 to 3 for that valve to be triggered to open really forcefully and really good and let all that food. So delayed gastric emptying is partially due to not enough stomach acid. So if you're getting a sluggish emptying down here, this one's not closing up very tight, you're getting extra gas production, all this coming together, you're popping the valve open. So the guy that was on Dexilant after I had him on triple therapy twice a day, in 30 days I told him, well, what we did was get him de-stressed, get him off sugar, and then we supplemented him with hydrochloric acid. There's a supplement called betaine, hydrochloric acid, at every health food store. The health food store guys know this. I walked into our health food store place in Lubbock, and he handed me a sheet with a step 1, 2, and 3, how to resolve your reflux. And I looked at it and thought, man, you guys know this? He's like, man, we've been preaching this for 20 years. But it worked. It worked. The guy in 30 days comes back after 7 years of giving him more and more medicine. In 30 days, he's off his acid reducer, and he's not having heartburn, and it's sustained. It stayed that way. One more thing, as you move further down into your intestine here, this is your small bowel. You have a whole lot of small bowel. There are bugs. It's called small intestine bacterial overgrowth. You really shouldn't have a whole lot of flora or bacteria in the small bowel. It's mostly in the colon. But these guys will move up, or they'll come down from the top if there's not enough stomach acid to kill them. But you get an overgrowth of bugs in the small bowel, and the same thing happens. You get fermentation of that food. You get methane and hydrogen production. It increases your intra-abdominal pressure. You pop the valve. SIBO is a very, very common thing. 80% of IBS patients, it's small intestine bacterial overgrowth according to the studies. I didn't learn this till a lot later. And typically that can be resolved. We had a patient come see us when she was 5 years old. They diagnosed her with sour stomach. When she was 10 years old, they changed the diagnosis to a nervous stomach. And this is back, this lady's 60 years old when she came to us. But at 5 years old, that was her diagnosis, and at 10 years old, and all through her life, then she had IBS was her diagnosis. When she was on the IBS meds and they weren't working, subsequent to the IBS, she developed anxiety, insomnia, hypertension, and reflux, I think. But bottom line, her gut was the key to it. This IBS was everything I'm showing you here. She had small intestine bacterial overgrowth. She had an amoeba and a parasite. We wiped all that out. We restored her stomach acid, restored her flora in her gut, and her symptoms went away. And then everything else went away too. And that's what I want to talk about next. Let's go to lower down in your intestine. So the small bowel, there's 20 feet or so of the small bowel, then you get your large bowel. But in your intestines, there is trillions and trillions and trillions of bacteria. When I used to give this talk 4 years ago, I would quote 500 different species or kinds of bacteria in your gut. Since then, we now know it's native populations like the Maasai African tribes or the Peru Amazon Indians. When we study their flora, it should be more like 30,000 different species. Like there's Cocker Spaniels, Dachshunds, German Shepherds, different kinds of bacteria, 30,000 different kinds of where we should be. Your average American is at 5,000. Your average chronically sick American is closer to 500. Your gut should be lined with these good bacteria and some bad. It turns out it's an 85 to 15 ratio. 85% good guys to 15% bad guys, meaning E. coli, salmonella, parasites. You need a little bit of the bad guys. 100 to 0, 100% good, 0 bad, you're not as healthy. Of course, 50-50, you're not as healthy either. It's 85-15 that the research shows is healthy. So that your gut should be lined with all these good bacteria. And just like we talked about with the stomach acid, what do the good bacteria do? One, digest your food. I talked about the stomach acid, and I didn't mention, is my drawing still there? No, it's not. The gallbladder, we'll just talk about this real quick because it's an epidemic of these gallbladders being taken out. When, I think I can just actually, yeah, there we go. I have to draw, as you can see. Oh, it didn't work. Okay, we'll draw up here. Gallbladder. Your liver sits above your gallbladder. The gallbladder dumps into your small intestine, and the small intestine dumps into your colon. The gallbladder is just a sac that holds bile. Bile is a thin, watery green liquid, the consistency of water. The liver makes the bile. You make about a quart and a half a day of bile, and the liver's constantly making it all day long. But it stores it. It drips it right down into your gallbladder, and the gallbladder just holds on to it until it is signaled to squeeze. When the signal comes, it will squeeze, and it'll squirt that bile and help you digest your food better, particularly your fat. So guess what the trigger is for the gallbladder to squeeze? Low pH, good stomach acid. pH of 2 to 3 is one of the primary initiators of the trigger for the gallbladder to squeeze. So if the gallbladder's not getting a good squeeze because you don't have enough stomach acid, because you're eating all the sugar and you're stressed out, or you're taking antacid medicines every day, then what's happening? The watery bile just sits there, and it gets more and more concentrated. The body reabsorbs the watery part, and it gets thicker, more like honey or syrup. And actually, we call it sludge, and this is a medical term on a sonogram. If you go in with gallbladder pain or right upper quadrant pain, do a sonogram, sludge in the gallbladder. And more concentration, you can get stones. And we see this very, very common. Sludge or stones in the gallbladder. Gallbladder attacks periodically. Once you clean up the gut, you get the stomach acid back, you get the bile flowing again, it's no problem. But I just had to mention that because there's so much gallbladder issues today in America. So back to your colon, digest the food. So you got your stomach acid, your gallbladder enzymes, your pancreas squirts too, which by the way is also related to pH. But that's only like 3 or 4 or 5 enzymes that the body's made. And actually there's 17 total enzymes that the human body can make to break your food down. There's 20,000 other enzymes that your body requires to break the food down. And guess where you get it? These gut bacteria. The gut bacteria make enzymes specifically to break down the vegetables. And we don't have the capacity to make the enzymes. You have to have the bacteria to break those down fully. So digestion of your food is one thing that these bacteria do. Number 2, your immune system. 80% of your immune system sits right inside the lining of your gut wall. It's called the GALT, gut-associated lymphatic tissue. 80% of your troops, your Marines and Navy SEALs and Army Rangers, God put them right inside the lining of your intestine. Because if you think about it, the inside of this intestine is really still the outside world. Your mouth, your esophagus, your stomach, your small intestine, your colon, all the way to the toilet. It's really just a long water hose, and the inside of that water hose is really the outside world still. And God designed it beautifully because you don't want just anything penetrating and coming into your into your bloodstream and inside your body. So the cells that line the wall of your intestine, these cells are connected and glued together by something called a tight junction. And it's named exactly right. It's a very tight junction and nothing can penetrate. So the food that we absorb gets transported across the cell. So these cells are glued together, and the vitamins and minerals and amino acids and fatty acids, all your food products, get transported across the cell through a very orderly fashion. But if you've blown this, if you've blown that tight junction wide open, technical difficulty. Oh, I'm not connected. I think I may have to get a little bit closer. Y'all keep watching the screen. Don't look at me. I may draw from back here. You want to try to connect that for me, maybe? Sorry, Jed. You need your daddy? I'll just go talk. It just disconnected me. But I can talk through it if it won't reconnect. I think you may have to go stand by it. We'll just talk. Sometimes I do this without technology. It's just not as fun. All right. So those tight junctions, if they get blown wide open, then all kinds of stuff is leaking across. and hitting the GALT, the immune system, your troops that are right there. These troops are lining the gut lining because they're checking every single thing coming into the body. Is this foreign or is this not? Is this something I recognize? Is this a vitamin, mineral, fatty acid, amino acid? I recognize you, good. You go, you're good. But if it's something it doesn't recognize, it turns on and it stimulates that immune system. So if you're getting a constant barrage of a lot of stuff that the immune system doesn't recognize, you get a real hyperactive immune system. And that's part of the reason we have this autoimmune epidemic. There's over 100 autoimmune diseases today. 100 years ago, there weren't, but there are now. And it's not because we're just now diagnosed, that we're just somehow discovering these. These didn't exist before. 40% of kids today, asthma, allergy, or eczema, 40%, 4 out of 10. But it's going back to the gut and those tight junctions that are blown open, and the immune system's getting hyperstimulated. So the immune system also, the probiotics in the gut secrete chemicals that talk to your troops, your white blood cells. There's a communication between your white blood cell and the bacteria. And somehow, we don't know exactly how, it keeps your immune system primed and ready to go.
And I would just undo the Bluetooth and redo it.
Okay. Okay, thank you. I think it might be trying to unconnect again. So, I think sometimes I have to reconnect my pen. Y'all can take a potty break if you need to. The pen has to pair with the iPad for it to function properly, is what somebody told me. Let's see if that works. There we go. All right. A few technical difficulties, but we're back on track. So refresh your memory, digest food, all those 20,000 enzymes the bacteria make. Number 2, your immune system. The bacteria talk to your white blood cells to keep it nice and stimulated. Number 3, neurotransmitters. Neurotransmitters are brain chemicals, basically. Serotonin's one a lot of people know about. 80% of your serotonin's made in the gut. The bacteria in the gut actually are part of the production of your serotonin. The bacteria help you make it. Melatonin, same thing, 80% of your melatonin in the gut. So when you go to your doctor and you're sad and you're crying all the time and you just can't get over it, and it's been a month like this and you're not eating and you're in bed all the time, those are signs of clinical depression. So in the old days, I would spend a little extra time, give a little hug, give a little prayer, get out my prescription pad, write for Zoloft, Lexapro, Prozac, and see, you got to go. And now I'm thinking, okay, 80% of your serotonin's made in the gut. What's going on in your gut? Everything goes back to the gut. When you were in your mama's womb, there was this tissue, this embryonic tissue for the nervous system. It got split in half. Half of it went upstairs and half of it went to your gut. It's called the enteric nervous system. In medical school, we learned it to be the second brain of the human body. There's more nerves down here in your gut than anywhere else in the human body except for your central nervous system. And there's more neurological information sent from your gut, from your enteric nervous system up to your central nervous system than there is from your brain to your gut. More neurological information. So the nervous system and the gut they are highly associated. So neurotransmitters and other neurological information is sent this way. But here's the biggest thing. This is what blew my mind when I learned this from these doctors that are a lot smarter than me, is the bacteria, that line your gut. Besides all those jobs I just mentioned, digest your food, stimulate your immune system properly, neurotransmitters, there's other things we're learning every single day that these bugs do. But one of the biggest things, they just provide a covering for your colon and your intestine. And when that ground is covered, it prevents bad guys from setting up shop. Think of it like your nice green lawn out there. You have a nice green lawn, you fertilize it good, you water it good, it grows good. But if you took a plow and plowed a strip out of the middle of that lawn and you just had open, bare, empty dirt now, and you come back in a month, what would be there? Weeds. Yeah, full of weeds. Did you put weed seeds in there? No. They just come naturally because they're just there. They're floating around. They weren't there before because there was a covering. When that intestine is covered, these opportunistic, we call them, they're looking for an opportunity to come and set up shop, and they do. So in America, here's the biggest thing we've done is wiped out our gut flora. First, where you get these guys is your mama. When you're born, you don't have any gut flora. You come through the vaginal birth canal, you pick it up, that is where you get inoculated, your mama's birth canal. C-section babies, when we study their gut flora, they have, on average, skin flora from a hospital worker is the average gut flora of C-section babies. Breastfeeding, that's where you pick up the rest. Mom's gut during the last part of pregnancy actually opens up a little bit to allow the good bacteria, some of them, into that GALT, gut-associated lymphatic tissue, and it moves through the lymphatics to the mammary ducts and into the milk, and you get probiotics through the breast milk. So vaginal birth, breastfed, you're getting your probiotics. C-section birth, bottle fed, you're not. And that's one of the questions we ask all our patients. When we go back to the day of their birth, actually beyond that, we ask about their mom's health. And then we go through every single little tiny thing, because you have to if you're being a real detective. And that's a big question, vaginal or C-section, breast or bottle. That's where we get them. But then we end up killing them. Antibiotics. Antibiotics kill your gut bacteria. And the past 20, 30 years, we run to the doctor, we expect an antibiotic. Doctors feel the pressure to give you an antibiotic. And we have to take the time to explain, well, this is a virus, and, give it a few days, and if you don't get better, come back. But no one wants to come back. You're paying your copay, you missed work, your kids give me an antibiotic, give me a Z-Pack. We feel the pressure, we want to make y'all happy, and that's led to this overuse of antibiotics. But 80% of the antibiotics in America today aren't given out by your pharmacist and your doctor. It's in the meat. It's agricultural antibiotic use. 80% of antibiotics in the meat, the milk, all the dairy products. I know it's low level. I always have a farmer in the room that says, Doc, I'm a dairyman, but it's got to be low level. It's got to meet a requirement, and it does. But God did not design us to eat low-level antibiotics 3 times a day, year after year after year after year. But antibiotics will kill your gut flora. Birth control pills kill gut flora. Roundup, glyphosate, the main ingredient in Roundup, kills gut flora. Glyphosate's approved for human consumption because the main pathway that glyphosate interrupts is called the shikimate, is how I pronounce it, S-H-I-K-A-T-E, shikimate pathway. The human body doesn't have the shikimate pathway, so no problem, we can drink Roundup. The problem is every single bug, including your gut bacteria, do have that pathway. And a researcher out of Germany, I forget his name, showed that 1/10 of 1 part per million of Roundup, it will kill gut flora. And the EPA a couple years ago raised the level to acceptable range of 40 parts per million, where 1/10 of 1 part will kill your gut flora. Splenda, 50% of your gut flora dies from consistent Splenda use. Chlorine kills flora. Fluoride does too. Basically what I'm getting at, we're all killing our gut flora. A high sugar diet kills gut flora. Not enough stomach acid kills gut. Acidophilus, acid loving. Some of y'all know about acidophilus. It's a probiotic. Acid loving. Loves an acidic environment. If you don't have it, it doesn't grow good, doesn't reproduce well. The point is we're killing most of these guys off. A lot of us are. So when you wipe out your good gut flora, just like if you wiped out your green lawn, opportunistic guys move in. And what moves in oftentimes is Candida. Candida is a type of yeast or fungus. We need these guys. We need a little bit of them, not a lot of them. A little bit of these guys is beneficial because they're kind of like the garbage men of the human body. They can actually metabolize some of your food that made it all the way down to the colon. They can get a little more nutrition out of that for you. So we need Candida, just like we need buzzards and coyotes and all the scavengers, or we'd be full of roadkill. You got to have some Candida. But if you wipe out your good guys and then you put Candida fertilizer in, you're going to get a whole lot of candida. Candida fertilizer is sugar and grains that turn right into sugar. Wheat, the number one grain consumed in America, gets changed into sugar within 5 seconds of your saliva working on it. The new modern wheat does. Wheat Belly, a book by William Davis, cardiologist from Wisconsin. It's a great book. It's the one book I recommend if I'm talking to a doctor who I'll see patients from other doctors and they'll get better and they'll go back to their doctor and the doctor will raise his eyebrow and say, "What happened to you?" And they'll call me and I'll try to tell them this stuff. And of course they don't really believe it, just like I didn't, so I don't blame them. But I'll give them one book to read. It's Wheat Belly, because he really lays out an amazing case for how inflammation is the root of every disease. Inflammation is driven by sugar. The wheat today turns into sugar like that. When Norman Borlaug changed God's wheat, now I had biscuits and gravy last weekend. Now we've got wheat flour in our bin, but it's einkorn wheat. That's the original wheat that God made. Everyone always tells me, Jesus ate bread, why can't we eat bread? And you can't eat bread, but eat God bread, not man bread. God food, not man food is what I tell people. So the wheat God made was about 4 foot tall, 5 foot tall, called einkorn. Einkorn wheat has 14 chromosomes. The wheat we're all eating today is dwarf wheat, and it's about 18 inches tall. It changed into dwarf wheat in 1970, roughly. Norman Borlaug hybridized God wheat into dwarf wheat because yields 10 times greater. Dwarf wheat, you get 10 times more per acre than you do with God's wheat. It's drought resistant, it's wind resistant, it's everything resistant, so you make more wheat. He won the Nobel Prize because he cured world hunger in 1970, Nobel Prize winner. What he didn't know then, but Dr. Davis explains very well in Wheat Belly, is he changed the starch content. And today's wheat has 42 chromosomes compared to 14 chromosomes that God made. Those 42 chromosomes code for a lot of different things. A lot of it is gluten. Gluten is, everyone thinks gluten is one protein. It's actually, there's a number of proteins. We clump them all together, call it gluten. Most of the gluten people react to today is new man-made gluten from these new hybridized, not the original God gluten. And gluten also blows those tight junctions wide open in your gut. But back to the point, he cured world hunger, but he didn't realize he created a whole nother problem. The starch content changed. The wheat starch, amylopectin A to amylopectin B ratio. You read about it if you're a scientific guy and want to know the details, but basically what I'm telling you is the starch content of this wheat is able to be broken down very, very, very rapidly, where 2 pieces of whole wheat bread will raise your blood sugar as much as a can of soda. And that's on the back of his book, of the Wheat Belly book, is 2 pieces of whole wheat bread, just to get that point across. The glycemic index, that's a measurement, and that's whole wheat anything. Whole wheat pasta, whole wheat cereal, whole wheat crackers, whole wheat whatever. And I know that you've been preached to, whole wheat's better than white, well, it's all wheat. Just Google glycemic index. That is a tool you can use. This is one of your take-homes. Glycemic index is a tool. If you're wondering, is this food okay or not, just like white bread, Google glycemic index and wheat bread, white bread, doesn't matter, apples, oranges, pina coladas, whatever you want to Google, and it'll give you a number. And you want that number to be 50 or below, and what that means is it's not going to raise your blood sugar very much. You get above a 50 and you start raising that blood sugar. You get up to 70, 80, or 100, you're really spiking your blood sugar. And that's your homework for tonight. Go do a Google glycemic index on sugar and then do wheat bread. So that was a little bit of a tangent. The point is the grains, wheat in particular, but corn and rice will do it too, will turn into sugar pretty quickly. And sugar feeds the candida. That's the point. You're fertilizing candida, and you're shutting your stomach acid off, and you're not feeding your good bacteria, the acidophilus that loves acid. So it's this environment we've created through our diet, lifestyle, our stress, our modern techniques of food processing that put antibiotics in the food. All of this together can compromise your gut flora, and the opportunistic guys go crazy. Now, most of our patients are really sick, really inflamed, and they've got a whole bunch of this is called gut dysbiosis or imbalance. Too many bad guys, not enough good guys. I'm picking on candida here tonight, but there's other bugs that can do this. So candida is a problem when it overgrows and it actually starts linking up together. Think of like a pearl necklace. If you just had a couple pearls of candida, no problem, but there's enough of them to line up to make a whole necklace, that's a problem. They become mobile and they move. They penetrate your leaky gut wall. Portal vein. Portal vein's your main blood vessel through your gut. It's where all your food and everything dumps into first. The portal vein is the highway that goes directly up here to your liver. The liver's the first stop for the portal vein. The candida jump across here into your portal vein. They travel along the portal vein into your liver. The liver is where we store extra sugar in the human body. If you have any extra sugar, that's where it's at. We all have extra sugar. So candida just found the gold mine, the Fort Knox, the vault for its fertilizer for sugar. And candida goes nuts in the liver. Overgrow, 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 overgrow. All your blood passes through the liver about every 3 minutes. Your liver's filtering your blood. It's the air filter for the human body. So it's cleaning your blood. All your blood's going through there. The candida jumps on the train and just goes for a ride, and it deposits in various places. This is a bone and a bone. They meet. This is a joint. So in the middle of where these two bones meets a joint, candida loves to go in the joints. Sinuses, prostate, the myelin. Myelin is kind of like the insulation on the power cords. That's the myelin on your nerves. Your coronary artery, the wall of your coronary artery, anywhere. These guys will land, but the most common, joint, skin, sinuses. And they just sit there and they grow and they grow and they grow. Now this is low-level growth. This isn't, because when I first learned this, I thought, well, that can't be, because these people will be what's called septic. When you have so much overgrowth, you get fever, you get low blood pressure, you overwhelming immune system response to this, and you can die from sepsis. This is low-level growth. So these guys sit there. Well, the immune system sees all this going on. The immune system sees the overgrowth in the liver. It sees the overgrowth in the joint and wherever. So the immune system turns on and fights. The immune system fights with chemicals called cytokines, histamines, leukotrienes, all these different chemicals of mass destruction. Your immune system just turns on all this chemical weaponry. That altogether equals inflammation. That's your other homework for tonight. Go home and Google the word inflammation plus your disease. Whatever, or your symptom. Migraine headaches, coronary artery disease, Alzheimer's, cancer, autism, chronic sinusitis, any itis, diverticulitis, sinusitis, all the prostatitis. Inflammation is linked, we now know, to every Western disease pretty much. Inflammation's at the root of it. Inflammation is right here. It's your immune system. It's all those chemicals I just told you about. Your body, your immune system's turned on fighting something. That's the main deal here. This is where functional medicine gets it and no one else gets it. This immune system's not randomly turning on for no reason. In medical school, we're taught the theory, and they kind of don't say theory very loud, but it is a theory, on autoimmune disease. We'll take MS right here, the myelin. So you're going along, cruising through life, no problem, about 35, 40 years old. All of a sudden, your immune system goes, I don't recognize that myelin as me anymore, and I'm going to attack it. Your own body attacks yourself for no apparent reason, is the theory we're taught. So if that theory is true, the only option you have is to sit there and suffer and let the immune system continue to kill your myelin and you'll die early, or shut your immune system off. And that's what we do. So all these chemicals I mentioned up here, the drugs, shut those off. Anti-leukotrienes, that's singular. Antihistamines, y'all are aware of all those. Anti-inflammatories in general, but like Phil Mickelson, the golfer, I think it's psoriatic arthritis. Humira, I think is what his commercial is. These high-powered drugs, steroids, prednisone, they're really good at shutting this off. Super, super good. So how would you feel if your immune system, if you tell the troops, go back to the barracks, put your grenades and flamethrowers and rocket launchers away, quit fighting, get back to the barracks, go to sleep. There's no war. There's no enemy here. You'll feel better. The redness, pain, swelling, inflammation, stiffness, all that inflammation's gone. So you feel better. So that's great. The problem is the enemy troop is still there. Your guys just got told they're not, but they are, so the problem's not fixed. And that medicine kind of quits working. And this is the patient that comes and sees us. Crohn's, ulcerative colitis, we'll use psoriatic arthritis. Great example, a 52-year-old gentleman from Childress, Texas on methotrexate, sulfasalazine, and Remicade over I don't know how many years, 20 years, he's had psoriatic arthritis. He came and saw us, and today he's not on any of those medications, and he does not have any joint pain, and his psoriasis is gone. And he's totally symptom-free, off his meds. And it took about 15 months. And he's going to do a testimonial on our websites, not to pump us up, but to give you hope. If you have psoriatic arthritis and Phil Mickelson's chirping at you every night on the TV, there is another way. And I wish I knew Phil Mickelson, because there is this other way. And it works almost always. And I'm not here to preach against medications. My point is, there can be and usually is a root cause. So option one should be do that. Now, if Mr. David from Childress came and saw us and we worked hard and hard and hard on him and just couldn't get anywhere, no problem. We have methotrexate and Remicade and sulfasalazine to give him. Now, there's lots of side effects potentially and a risk that come with those, but what else are you going to do? You suffer, take the medicine. And it's fine if a patient elects to do that, but the problem is the number 3 killer in America right now after heart attacks and cancer is me. Doctors. Prescription medications and procedures appropriately prescribed is the number, conservatively, some people put it number 1, but not here to implicate Dr. Aker. I'm kidding. He's a great doctor and a great guy, and I highly recommend him, and go see him if you haven't. This isn't about doctors and conspiracies, and people come to me all the time and say, oh, I know those pharmaceutical guys. They'd come in your office and post, and they'd line your pockets with little money and all this stuff, and no, they didn't. I got a pen and a sticky notepad. I didn't even get dinner. Maybe I'd get some burritos from the burrito stand at lunch from them. I didn't know any of this. I mean, I'm doing what I'm trained to do. I have a radio show. A caller called in one day and said, Doc, my dermatologist told me that my eczema or psoriasis, one of those, has nothing to do with diet. It's all genetic. And I said, ma'am, your dermatologist isn't lying to you necessarily. He's just ignorant. He's not trying to deceive you. He's not trying to keep you down, keep you sick, keep you on drugs because he's getting a kickback. He doesn't know. Because his dermatology professor at school taught him that diet had nothing to do with it. So that's what he's telling you because he truly believes it. And then I got to tell her about the worst eczema case I've ever seen in my whole life, even from medical school at UT Houston. I didn't see one this bad. This 7-year-old boy came to us, walked in sweatpants and a shirt, and his mom proceeded to take his sweatpants down, and he was wrapped up like a mummy in an ace bandage. She took the ace bandage off, and there was a cotton wrap around that, and she took that off, and he had all this cream. She said every day and every night, I lather him up with the cream, I wrap him up with cotton, and I wrap him up with an ace, and he's like a mummy, and he goes to bed every single day. Been to every dermatologist they could go to, been battling this for a very long time. Horrible. I mean, his legs were red, peely, awful. And today he's totally fine, and it was probably 6 months or so. He's totally fine, and he's not taking steroids, he's not taking any anti-inflammatories. So when you see that, and all we did was heal his gut. When you see that and you see it over and over and over, you start to understand, well, maybe diet does have something to do with it. So the doctors just aren't taught, so they don't know. That's my point. Now I'm getting way off track. Inflammation is where I'm going back to. And I would say this is a theory also, the germ theory, the candida that goes to the liver and moves around. But research has shown in biopsies of various tissues, including your coronary artery tissue, for instance, dental bacteria in the coronary plaque, dental bacteria that only is found in the mouth. We know there's an association with periodontal disease and coronary disease. But now we're finding it with all these other diseases. And in fact, arthritis, this was 1940s. There's a book by David Brownstein, Curing Arthritis or something like that. David Brownstein's the author. He talks about 2 guys working at some university, in a lab across the street from each other. They were working on arthritic patients. One guy was aspirating the joint, sucking fluid out of the joint of arthritic patients, and he was finding mycoplasma, a bacteria. The guy across the street was working on a new steroid that he just discovered, cortisol. It's a strong steroid. And he gave patients cortisol, and their arthritis symptoms went right away. And everybody got real excited, and the media and everybody, all his colleagues, cortisol, it's a cortisol deficiency that causes arthritis. Cortisol is just a really big anti-inflammatory. So everyone went that route of treating with cortisol, and everybody forgot about this guy that found mycoplasma. And what he did was get rid of the bug in the joint, and the arthritis went away. And we see this over and over and over and over, just no matter what your disease or diagnosis is. So real quick, I want to run through a little bit of science, because it's always good to prove some of this stuff. We're going to go through some different bacteria in the gut that are starting to be seen in the literature as associated with different diseases. This particular study showed that diabetic kids have 25% fewer gut bacteria overall, but they had an overabundance of 2 particular strains of bacteria that are associated with triggering inflammation and causing antibodies that attack the pancreatic cell. And that's the other theory. It's not a theory, it's proven now, but cross-reactivity. Bugs penetrate from your colon, or food products, antigens, proteins, penetrate and stimulate your immune system, but it cross-reacts to different tissues in the body. This study kind of confirms that, or it shows that it could be contributing. These 2 bacteria cross over, stimulate your immune system to hit your pancreas, knock it out, you have diabetes. These 4 bacteria, FLVR, I'm not going to pronounce those, kids with lower levels of these 4 particular bacteria have more asthma. These bacteria are protective against asthma. This researcher out of Australia, kids with peanut allergies, these are the severe peanut allergies, anaphylactic shock, need the EpiPen, can't even go in a room with peanuts. 80% of them cured with 1 strain of probiotic, this Lactobacillus rhamnosus. That's out of Australia a couple years ago. This one, methanoprovolone, that one, the increased number of these are associated with the hyperstimulation of the immune system and associated with more MS, multiple sclerosis. But the other part of this study, they looked at the gut bacteria in India, in the Far East, and their gut flora, and they have very little MS there. And then they watched the transplants, the immigrants that came over from India, and over time, their gut flora changed to American gut flora. And their MS rates went right up to our MS rates. We see that with breast cancer. Japanese women, very little breast cancer. They move to America, their breast cancer rates go right up to our rates. It's a really interesting study on gut flora. Here's 94 different strains of gut bacteria that break down gluten. So everyone's, gluten-free and this gluten sensitivity, and half the people believe it, half the people don't. Oh, it's a real deal. Part of it is the new gluten that the body's never seen before, but it's new since 1970. But a big part of it is we don't have the gut bacteria anymore to break it down. So it's pro-inflammatory. It opens your tight junctions. 94 different strains. Most of our patients that are gluten sensitive are missing these strains of bacteria. And that gluten drives inflammation. What we're always looking for in our clinic, we know you're inflamed. You're coming to see us with Crohn's. We don't really care about the label. We know there's inflammation. Why is there inflammation? Because there's a germ or a toxin that's turned on your immune system. Our job is to figure out what germ or what toxin, get it out. Your immune system turns itself off. Mr. David from Childress with psoriatic arthritis, that's what we did with him. Find what's turning it on, get it out. You don't need Remicade to turn it off. Your body turns itself off. God did design our body pretty amazing. You never think about a paper cut. You get a paper cut, you don't blink, you don't think twice. But if you stop for a moment and think about that, your clotting cascade is very intricate. There's lots of steps to build a clot. And if you don't hit that just right, you won't clot and you bleed to death from a paper cut. And the vice versa, the flip side of that, if you clot too soon, or too aggressively, you just start making clots when you're not supposed to, you die from blood clots. That system is just so amazing. We couldn't even design it ourselves with all our technology and our smarts. God's amazing design is beautiful. It will heal itself if you give it what it needs, avoid what it doesn't. Here's different pesticides and BPA, that's the lining of the plastic water bottles, and I'm not suggesting you go eat BPA, and it's an endocrine disruptor. It disrupts hormones, a lot of infertility and hormone issues in a lot of these young ladies. BPA is a part of that. Pesticides, but these gut bacteria break them down. So God gave us all these different layers of protection, and the gut bacteria is part of it. This one, Bifido, they showed that it halted melanoma. When they didn't have Bifido, the melanoma progressed. When they added the Bifido, the melanoma went away. Probiotics and dental health, it's just a cool study that showed that oral probiotic destroys certain bacteria that are associated with different diseases like Alzheimer's, heart attacks, liver and kidney disease. Vitamin C, the human body cannot make vitamin C. We're one of only three mammals that can't make vitamin C. When a horse gets sick, it ramps up its vitamin C production. It's a great antioxidant, helps put out the flame of inflammation, but we can't make it. So a lot of people take vitamin C, and that's fine. I like to eat my vitamin C, but the point of this study was your gut bacteria, they make it if you nourish your gut. And that's the point I'm getting to here is nourish your lawn. Nourish your gut flora, because it's going to do amazing things for you. We're barely scratching the surface of understanding what all it can do. This is another gut bacteria that produces folate, which is a B vitamin. You know, pregnant women, you get them on folate. It's the bacteria in the gut that make it for us too. Fecal transplants. I saved this for the end so you wouldn't think I was too crazy, but this is exactly what it says. You're taking fecal matter. 2/3 of a normal stool is bacteria, and the wide variety of bacteria. And when you get a healthy patient and you put this in, amazing things happen. We had a lady with Crohn's. We see a lot of Crohn's and ulcerative colitis. Go on our website and watch the testimonial from Dr. Jeff, doctor in Amarillo, for 20 years. Suffered, almost had to retire. He went to residency in Waco, where Dr. Aker and I went. Was in the bathroom between every patient having diarrhea every single day. And now he's totally fine. So, and he got fine in 6 months. We have a 22-year-old from Amarillo who got fine in 6 weeks. He was like 80 pounds, 22 years old, 80 pounds. In 6 weeks, his symptoms totally gone. But we had another lady who for over a year was with us, did everything we asked her to do. I mean, she hit a home run, did everything perfect. This lady was hardcore and got 10% better, 20 bloody stools a day. We sent her to Dr. Shepard in Tampa, Florida, who's the leading expert on fecal transplants, and after one fecal transplant through a colonoscope, and then she did an enema fecal transplant the next day in his office, and then a third one the next day in his office, and then a fourth one a week later at her house. 4 transplants, 1 through a scope, 3 through an enema. 4 weeks after that, symptom-free. After 10 years of bloody diarrhea every single day, and did everything we knew to do, a fecal transplant. But this is showing type 2 diabetes, MS, autism, these other things can be reversed in mice. They've done this in mice with fecal transplant. Human studies are coming next. The point of that is the power of these bugs we are hardly comprehending. Here are the number of studies. If you Google on PubMed microbiome, which is the name we're giving this environment in our gut of all these bugs, microbiome in the title of medical journal articles, you can see in 2007 was the first one. And from there, it has skyrocketed to 2015. There's over 2,000 publications. Every day, I'm seeing a new article on, well, this bacteria does this. With MS, T helper cells, part of your immune system, the T helper cells help to regulate, not T helper, it's T regulatory. So a T regulatory cell, it's an immune system cell that puts the reins, puts the brakes on your immune system. Your immune system's powerful. It can kill you like that. The anaphylactic shock. A couple years ago, the little boy down in Corpus Christi in the football huddle, junior high game, the ants bit him and he died in the huddle. Your body, if that immune system decides to dump all that weapons of mass destruction at one time and all that histamine, boom, you can die. So the immune system's powerful. It needs to be regulated and reined in. T regulatory cell helps to do that. And they found a gut bacteria that stimulates the gene in your genome that turns on T regulatory. Gut bacteria secretes a chemical, turns on your gene that turns on T regulatory that reins in your immune system. MS patients have fewer of that gut bacteria. They're not reigning in their immune system as well, and it's associated with MS. So there's so many cool studies coming out that are starting to give us a glimpse into the world of the microbiome. I don't think we'll ever understand it all. I don't think we'll ever understand the whole human body. We think we kind of do, but you go back to the statistics I gave you earlier in the night. We go to the doctor more and take more pills, do more procedures, spend more money, and have the worst outcomes. We think we've got this all figured out halfway, but we really don't. And we're sick, and our life expectancy is the worst, and our infant mortality is the worst. But there's hope. That's Dr. Jeff. Go to our website if you want to get more inspiration. Jeff Welchel, ulcerative colitis, symptom-free today. It's a powerful testimony. This one went up last night. 10,000 people watched it from last night till this afternoon when I last looked. This young man right here, you'll see in the testimonial, he used to be a short, squatty, thick boy with ADD and anxiety disorders and horrible asthma. He described it as a vine, a thick vine wrapped around his chest where he was being squeezed all the time, on 4 asthma medicines, averaging 3 asthma attacks a week, been to multiple pulmonologists and allergy doctors, couldn't play basketball, couldn't do anything. And the steroids were making him puffy and big and messing up his metabolic stuff. And it's just a beautiful interview. Because this kid, thanks to his mom, but the kid got out, Brinson got after it, and he changed his diet. And that's pretty much all he did. And it took time. But now this kid, you can kind of tell, he's trim and strapping, and he's lifting weights, and he's playing basketball and football and track. He ran track this year. He played violin in the band. He's going to do trumpet next year. Trumpet, asthma. He set the goal this past year to make all A's. He used to be a C student, all A's this past year. ADD and anxiety, a thing in the past. And he fixed his gut. Another testimonial, this was a rheumatoid arthritis patient. And and I didn't even see this patient. And that's kind of the point of these too. I don't see these patients. I can't see everybody anymore. We have 6 nurse practitioners. They see all these patients. I go into certain ones when needed, but I go give talks now. And I never even saw this lady. So it's not about me. I'm not that smart. I told you I'm middle of the pack, or I don't know if I told you, but I'm telling you now. Med school, middle of the pack. I'm not the smartest guy in the room. And maybe that's to my advantage. I'm smart enough to know I'm not that smart. God's a lot smarter than me, and his design is perfect. Get out of the way and let it do what it wants to do, which is fix itself. I didn't even see this lady, and she's off her medication. She was spending $700 a month copay to her meds, and today she's not. Interstitial cystitis, that's inflammation of your bladder. That's like you have a UTI, bladder infection all the time, but you don't. And there's no real treatment for it. In med school, there's just not good treatment for it. This lady, for 30 years, had interstitial cystitis. In the past 10 years, was to the point in pain every single day, up to the bathroom 10 times a night is what she told me, and I didn't really believe her because you can't even sleep. I mean, she was in tears, desperate, crying, y'all are my last hope, blah, 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 all this stuff. And I didn't see her either. Symptom-free. Changed her diet, basically. What we do is work on the terrain. Louis Pasteur himself, on his deathbed, reversed. He's the germ theory guy. In his career, he came up with, there's germs, and you take antibiotics to kill the germ, and you're cured. And to a degree, that's right. But on his deathbed, he flipped and said, the germ is nothing. The cell is everything, meaning the terrain. You keep your terrain right, these bugs will come in and go out, no problem. I had a guy the other day see me. He was trying to donate blood at the blood bank. They wouldn't let him because he had West Nile virus that showed up in his antibodies or something. And he came to me and said, Doc, West Nile? I had West Nile? And I said, well, yeah, I'm sure you had it, but you didn't know it because your immune system's so good and strong because this guy's really healthy. These bugs come in, you do your job, and they go on. This is a very powerful testimony. This little girl, this is the mama, but her little girl, 7 years old, worst allergies I'd probably ever seen. She was allergic to dirt and the outside is what the allergist said. You're allergic to dirt, so you can't go outside. And smoke. So they had to change out their wood burning logs in their fireplace and go to gas burning logs. She had to quit the Girl Scouts, couldn't do campfires, couldn't go camping, couldn't play outside. The kids at school go out to recess. She sits in the classroom, looks out the window and cries because she can't go play. Can't play softball, can't play soccer, on Singulair, on Zyrtec, on Pulmicort, and albuterol. Every time she goes outside, it starts in her head, runny nose, drainage, turns into bronchitis, gets on an antibiotic, and this is a recurrent thing every couple of months. Did allergy shots, did allergy testing, did everything. This family was desperate. They came and saw us. It was her gut. She had a hyperpermeable intestinal wall. She had dysbiosis of her gut flora. Her immune system was highly stimulated by the gluten. We reduced that gluten or eliminated it. Then we healed her gut wall. We gave her the probiotics back, got her stomach acid back, got the rest of her immune system function normalized. Now she can eat a little bit of gluten and be fine. But she's symptom-free. She's off all those meds. Her mom called me at the first day of school this year and said, crying, "Doc, thank you so much. I'm sitting here in the parking lot looking out to the playground, and my little girl's out there rolling in the dirt playing with her friends." All right, so what can you do now? The 4 pillars is what I call it: nutrition, hydration, movement, and peace. It's not complicated. Eat God food, not man food. If your great-grandparents were eating it, pretty much you eat it. If you can pick it, grow it, shoot it, catch it, eat it. The problem is if man has changed that food, then watch out. And I'm not saying it's 100% off limits. I'm saying you're responsible to think for a minute, why did man change that food? What did they do to it? And what are the consequences of that? The Bt toxin. The Bt toxin is corn. GMO corn, they put the gene in for the Bt toxin into the corn. So the corn produces the Bt toxin, it kills bugs. It's a natural pesticide. The plant's making the pesticide now. So you don't have to spray it. You eat that corn with Bt toxin, your body digests the corn, that genetic information is transferred into your gut bacteria. The gut bacteria start producing the Bt toxin, and that's detrimental to your gut health, as you could imagine, and you start killing your flora off. That's one example. Know what these things, when we change the food, I'm not saying it's automatically going to be detrimental to your health. All I'm saying is pause, think about it, research it maybe, study, get on our website, listen to more videos, just learn, get educated. If man changed it, pretty sure he wasn't having your health and the health of your cells in mind when he changed it. Now, I'm not anti-making money and anti-capitalism and anti-farming or anti-anything. I'm just for God's original intent. How did God originally intend for us to live and function and move and breathe and eat? And that's the 4 pillars. So we eat God food, not man food. Fruit, always get asked about fruit. God made fruit, eat fruit. God made fruit to come in season, in the summer, basically. Not all year long, 24/7 eating fruit. And most of the fruit today is hybridized to be more sugary because you're not going to eat it if it's sour. A Granny Smith apple or a Fuji apple. You'll pay $5 a pound for Fuji because it's sugary. 99 cents a pound for Granny Smith, it's not sugary. We're addicted to sugar. Sugar's a drug. Act like it. Treat it as a drug. It's a fine white powder just like the other fine white powder. You wouldn't give your kids cocaine. Be careful on the other fine white powder. It stimulates the part of the brain that spits out dopamine, which is the hormone that gets you hooked and says, "Oh, that was good. Go give me some more." Alcohol, gambling, whatever, marijuana, cocaine. The same thing with sugar. You spit the dopamine. It says, "Give me some more," and you're hooked. Sugar's more powerful than cocaine. A study with 50 lab rats, they fed them cocaine water for a few days, shut it off, fed them sugar water for a few days, shut it off, opened the door to both waters. 48 out of the 50 went to the sugar water because it stimulates more dopamine rush out of the brain than cocaine does. So easy on the sugar. It's in everything because they know a food producer wants you to buy more food. That's how they make money. Get you hooked on the food, you'll buy more food. Sugar is a drug. Coca-Cola used to be in a little 6-ounce can. There's a little bit of sugar, a little bit of salt, and then it went to 8 ounce, then 12, then 16, 18, whatever we're up to now, 20-ounce bottles. Every time they increased a couple of things. Because caffeine's a diuretic, makes you urinate out water. So you drink it, you urinate out more water, that makes you thirsty, but salt, they put salt in there. Go look how much sodium's in your Coke. More salt was put in. With each time they gave you more Coke, they gave you more salt. It makes you more thirsty. But you're not going to drink salt water. So they got to put more sugar in to cover up the salty. So there's more salt, more sugar, more volume, and it's just this, So be responsible for what's going in your mouth. Just be aware. Sugar's in everything. We had a quarterback, a strapping, healthy, strong, starting quarterback from one of these teams near Lubbock coming to see me because of chronic sinusitis. Mayo Clinic, or no, it was John Hopkins, 98% of chronic sinusitis. They went up and studied 100 test subjects, 98% of them, 3 different fungal species in the sinuses. Antibiotics treat bacteria. These are fungal. 3 different funguses on average in the group of chronic sinusitis. So this kid had chronic sinusitis, and he brought his lunch with him because he said, Doc, I know you're going to talk about nutrition, and I've got it already figured out. Here it is. My friends at school are eating Dr. Pepper and corny dogs and Cheetos. And I said, let me see it. He pulls out a Gatorade, baked Lay's potato chips, and whole wheat bread sandwich with meat and veggies and tomatoes and all that. And I said, all right, flip the Gatorade over, read the ingredients. High fructose corn syrup, that's sugar on steroids. Flip the chips over, read the ingredients. Sugar in the baked Lay's potato chips on the ingredients. And we already talked about the bread and the whole wheat bread. There's sugar in it, but it also, as we talked about, the wheat turns into sugar. So you're getting it even though you don't know you're getting it. That breakfast up there earlier, the skim milk, there's nothing left in skim milk but what turns to sugar. OJ's pure sugar, all fruit juice is pure sugar. I was starting my day back in the day with OJ skim milk, just like that picture. I was spiking my blood sugar, therefore spiking my insulin first thing in the morning, and the roller coaster was on. I'd be hungry about 10 a.m. I'd go grab some peanut butter cookies. Here we go again. And we do this roller coaster all day long with our sugar and our insulin. So be careful on the sugar and the grains that turn into sugar. Hydration, clean water, that's basically, water, tea, coffee, fine. Those are made basically from water. Those are fine. There's antioxidants in coffee. I love coffee, no problem. Careful what you put in it. I'd prefer you go organic coffee. Coffee bean is one, actually it's a berry, but that plant will soak up more toxins than almost any other plant. So if you're going to only go organic on something, coffee would be a good choice. Also look up Clean 15 and Dirty Dozen. It's a list of the foods that if you can't go organic, okay, but at least the Clean 15, the Dirty Dozen, try to go organic. Movement, we're designed to move around. I won't get into this, but there's tons of studies that calling it sitting disease. If you sit for 8 hours or 6 hours uninterrupted, you increase your risk for about every disease known to man. So just get up and walk every hour. Get up and walk down the hall. You don't have to go to the gym and exercise necessarily. And in fact, they showed you sit 8 hours at your desk all day and then you go to the gym for 45 minutes at the end of the day, did not reverse the effects of the 8 hours of sitting. So get up throughout the day. Find something you enjoy. You don't enjoy going to the gym, don't go. You like walking your dog, walk your dog. You like go hunting pigs, go hunt pigs. Just move around. Peace, this is the big one, and probably it should be the foundation, and there be 3 pillars, because people that don't have peace don't get well. They eat right all day long, they go to the gym every day, but they're in fight or flight mode, and they don't have peace, they don't get well. So that's in a nutshell what I think you should do. Thank y'all for having me tonight. There's 3 books here that I recommend. Grain Brain, Wheat Belly, Paleo Cardiologist. If you read those, get on our website, watch the interviews that we have with other doctors on the website. I've got radio show interviews on there. I've got my teachings on there. The point of the website is to teach. So get on there and learn. And then maybe I'll come back someday and we'll talk about peace, because the Lord's really been showing me in the past 6 months this lack of peace in people is the number one driver of illness. And yeah, the nutrition is where everybody starts, and it's good. But without peace, and it's a spiritual issue that robs your peace typically. So our website's veritasmedical.com. Again, we're not looking for business. We're booked for probably a couple of months. We'll see if we'd be happy to see you, but I'm not here to try to get you to come see us. I'm here to educate you. So get on the website, learn more. I will say this, not everybody gets well. All those amazing testimonials are amazing. And the reason we put them on there is to give hope, because most of our patients come in like that mom with the little girl on the playground, lost hope. They have no hope, 0 hope. Got off the phone with a girl in Odessa, 35 years old, stuck in her bed, can't get out of bed. She's been to Mayo Clinic twice. Nobody can figure her out. We're going to go make a house call on her. Who knows? I'm not saying I know what's going on, but I know I'm going to look at it differently than the Mayo Clinic does. They're Mayo Clinic and they're really smart, but they're doing the same thing everybody else is doing. We're all learning the same curriculum. Harvard Med School is teaching the same thing. UT Houston's teaching the same thing that Tech is teaching. The curriculum's pretty much the same. They're a little smarter over there, but basically you're going to get the same thought process. And that's the problem. We're taught a certain narrow way, and that's the only way we're taught. I had a little old lady come see me in Post, Texas, before I knew all this. And she had chest pain. And medicine's really a matching game. In med school, they teach us to do a matching game. Someone comes in with symptoms, you got to match it to a diagnosis. I call it a label now. And then that's it. Your game's over. You just matched it to your diagnosis because every diagnosis has a corresponding drug, a prescription, basically. I mean, that's it. So a little old lady on a Friday afternoon, 78 years old, comes in with chest pain, and I'm thinking, oh, great. Old ladies with chest pain on Friday afternoon is not a good thing. I want to get home and play with my kids, and now I got this little old lady with chest pain because I'm thinking, angina and heart attack. But very quickly, you ask a few questions. Where's the pain at? Is it kind of left-sided, radiating to your arm and jaw, and kind of a pressure like an elephant sitting on you, and you get short of breath, and it's better if you sit and relax, and it's worse when you get up and move and you get a little sweaty? If it was yes, 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 obviously, that's heart origin. That's angina, that's blockage. But her chest pain was more in the middle of the chest, more of a burning, more when I laid down, more after I eat tomatoes, better when I take some Tums. And that was her answers. So that was good. I can match the matching game. Her symptoms match to GERD, reflux, heartburn. So it was good. This will be a 2-minute visit. Got out my prescription pad, started writing a prescription for Prilosec, went to hand it to her, and she wouldn't take it. I said, okay, ma'am, what's the problem? Here's your Prilosec. She said, Doc, you're just treating my symptoms. And I looked at her, and this is way back then, and I said, what? It didn't register. Y'all get it probably, but I didn't, and most doctors don't get it. She said, you're just treating my symptoms. I said, no, I'm not. This is a disease, GERD. GERD, D for gastroesophageal reflux disease, GERD. This is your disease. You got acid in your esophagus. This is a treatment. Take it. And she wouldn't take it. I said, ma'am. So I went to the scare tactic. Ma'am, you're going to hurt every night when you lay down. And you'll probably get esophageal cancer because the acid hitting that esophagus is not supposed to do that, and those cells don't like that. It's going to turn to cancer. And she said, you're just treating my symptom. I said, I don't know what you're talking about. This is a disease. This is a treatment. Take it. I don't have time to argue with you. And then I went biblical on her. One last try. Diseases came. Adam and Eve in the garden sinned, disobeyed God. That brought in death and dying and illness and disease. And luckily for you, God made doctors with smart brains to figure out all these medicines to help so you don't suffer. So your option is 2 options. Option 1, suffer and maybe get cancer and don't sleep good every night. Option 2, take this prescription, go to the pharmacy, get it filled, take it tonight and be okay and don't suffer. Option 1, option 2, I put it in her purse and I left. What she was getting at was there's option 3. At the time, she knew it, that there was this other option, get to the root of it and fix it. But at the time, I didn't know there was option 3. Most of y'all probably don't know there's option 3. Doctors don't know there's option 3. We're not taught option 3, so of course we don't know there's option 3. But that's my whole message tonight is there's this other option. You don't have to pick it. I still got a patient from Post, and he drinks his Dr. Pepper and donuts every morning and says, Doc, I know, just give me the pill. And that's fine. I still love the guy. I write him a prescription. I don't care. It's no, water off a duck's back. It doesn't bother me. I'm kind of sad because I know he's going to probably have a heart attack. He's going to amputate a toe, and he's going to do he's going to slowly dwindle down his last 30 years of life. And that's what all of America's doing. You got a bag full of medicines, and that's normal. You're 50 years old and you're not on medicines. What's wrong with you? We think that's weird. To not be on medicine's weird and abnormal. Something's wrong here. Walking around to specialist every other month when you're 65, 70 years old and you have a bag of medicines and a list this long and you're going doctor to doctor, and that's normal. That is not normal. This is a new phenomenon. This is a new last 50 years kind of phenomenon. This is a Western American phenomenon. The Pima Indians, Southeast Arizona, 0 cases of type 2 diabetes ever in their history of the Pima Indians, ever. Pre-World War II. Post-World War II, when they moved to the reservation, ate American food, 50% of the Pima Indians are type 2 diabetic now. in the past 50 years. Well, there's the same genetics. This isn't genetics, guys. We've been harping on genetics, and it's not genetics. It is what's going in your mouth. It's your diet and your lifestyle. It's what's called epigenetics. You'll be hearing that word more and more in the coming months and years. Epi means above the genes. We have 25,000 genes. You're in charge of your genes. We now know you can turn your genes on and off. There was a slide earlier the ladies had, Dean Ornish, prostate cancer. He biopsied prostate cancer patients, and he looked at the DNA and he saw the cancer grow gene turned on, the cancer suppressor gene was turned off. He put these guys through 6 months of diet and lifestyle and de-stress, went back and biopsied the prostate, the cancer grow gene turned off, cancer suppressor gene turned on. And we see this over and over. The BRCA gene, you go get a mastectomy before you even have cancer, or you keep the gene turned off. And it's the diet and lifestyle that turns it on and off. Vitamin D is actually a hormone. It's made from the sun hitting your skin. The sun turns the cholesterol into D. It's a fat-soluble vitamin. It sits in the oil of your skin. It takes 48 hours to soak in. I was testing all the farmers, oil field workers, and ranchers in Garza County, and they were all low in D, and I thought, what in the world? You're in the sun all day. But they're bathing every night, washing the oil off, and the vitamin D goes down the drain. Everyone's deficient in vitamin D. So guys, you can bathe every Saturday night before Sunday church. Now tell your wives, Rob, I'm kidding. She'll probably kick you out of bed. But that's just the point. Of the 25,000 genes, 3,000 of those get turned on by vitamin D, and it's the 3,000 that run your immune system. It's these little things. God designed us a certain way to just hum along and move just right. All those gut bacteria interact with your genes. This is epigenetics. This is above the genes. It's the diet and the lifestyle that turns your genes on and off. So don't just say, oh, well, my dad had a heart attack, I'm doomed for that, or depression, or anything. There can be a genetic predisposition, but don't turn them on. So option 3, figure out what's triggering your immune system to create inflammation and eliminate that thing. But I can tell you 98% of it's going to be from your gut. And if it's not your gut, it's your mouth. Root canal bacteria and just gum disease letting oral bacteria in. Root canal teeth are dead teeth. There's bacteria at the base of the root canal teeth. Anaerobic bacteria secrete toxins, some of the most deadliest toxins known to man, according to the University of Kentucky. These toxins get into the body and drive inflammation. We had a young lady from Seminole, 25 years old, song leader at her church. Autoimmune disease of unknown, it wasn't a clear diagnosis. Maybe lupus, maybe not sure. For 2 years, rashes on her hands, 100.6 degree fever every day for 6 months, horrible headaches and joint pain and losing weight, and her hair was falling out. And Southwestern Medical School said, you've got an autoimmune disease. We're not sure which ones. Get on prednisone. For 2 years. She couldn't raise her 3 boys. She couldn't lead songs at church. She was stuck in her bed. She came to see us. She was bottle or breastfed, vaginal delivery, no antibiotics. 1 round of antibiotics in your first year of life sets you up for lots of different diseases, but she didn't have that. She ate clean. She was a healthy person. And then we got to the question about her dental work. Do you have any silver fillings? Because there's mercury in there. Mercury drives inflammation, especially brain inflammation. Do you have root canals? Yes, sir. I've got every tooth in my mouth is root canaled except for 3. That was the source of her autoimmune condition, of all her inflammation. It was the abscessed root, and she didn't know it. And the regular x-rays don't show it. You need to get a cone beam scan. That's a 3D CAT scan of your mouth, and it'll show every root canal tooth is abscessed to some degree because it's dead tissue. It's the only tissue in the human body we leave in there that has no blood supply. A root canal cuts the blood supply, cuts the nerve, and we leave dead tissue in there. Dentists will tell you it's sterile because they do things to sterilize it. What the research shows is there's thousands of microtubules that can't be sterilized. So Dr. Elizabeth Dannenberg in Lubbock, Dr. Dickie Stanley down in Marble Falls are 2 dentists we use. When we can't get to the root of the inflammation, we go to them, and that girl today is totally well when she removed her abscessed root canal teeth. And her granddad came in crying, saying how he got his granddaughter back, and she's leading songs again at church. So I'm going to finish now. There's option 3. You don't have to pick it. It's fine. Take meds. And you can also treat symptoms with supplements. Magnesium works great for blood pressure. Nitric oxide supplements work great for blood pressure. One more story. At UT Houston, 1999, Nobel Prize was won by one of my professors, and there's a huge party at UT Houston my freshman year because this guy figured out nitric oxide. Nitric oxide is a molecule secreted by your arteries, and it dilates, it relaxes your arteries. Blood pressure comes down, erectile dysfunction goes away. Nitric oxide. Nobel Prize. This guy figured out which plants, if you eat them, induce more nitric oxide production. And he knew most Americans aren't going to eat a lot of vegetables, so he juiced them, powdered it, evaporated the water off, got the powder, put it into a supplement, and sells it. It's called Neo 40. It gets your nitric oxide up. It treats ED and hypertension. Works great. A drug company heard about all this, moved him to Boston, hired him, moved him to Boston. For 7 years, he sat in a lab and tried to find a chemical mimic, a man-made chemical mimic of what he had already discovered that God had put into the plants. And he couldn't do it. For 7 years, he was unsuccessful. You can't put a patent on a naturally occurring substance like these plant chemicals. You can put a patent on it if you can find a chemical mimic, a man-made chemical mimic. He couldn't find it. After 7 years, he said, forget this, I'm going back to Houston. He's a team roper. He's got 2 little kids, lives outside of Houston. He's a great guy. If he would have been successful and found that chemical mimic, you would know about it, everybody know about it, it'd be on the commercials on TV, and your doctors would all be prescribing it. We learn how to prescribe medicines. We don't learn nutrition, herbs, or anything natural. Basically, if it's not patentable, we didn't learn it, unfortunately. That's a little harsh, but that's the reality I've learned. I got 1 hour of nutrition in 4 years of med school. Doctors don't know anything about the truth about nutrition. Maybe they do now. It's been 15 years since I was in med school, but when I was there, not really. So be responsible. Moms, you're responsible for these kids. It's the moms who, the hand that rocks the ladle rules the world. If you get your kitchens healthy, your churches, your schools, these kids, y'all heard the stats. It's going to be a first generation of kids to not outlive you. So it's the moms I'm really trying to get to. And it's not that hard. Eat real food, meat, vegetables, nuts, seeds, eggs, water, tea, coffee. It's real food. No big deal. Get the einkorn flour and make your biscuits. Okay, I really am done now. Any questions, though? I'm happy to take a question. Einkorn, where would you find einkorn? I find it at Natural Grocers in Lubbock, Texas, but Amazon.com would have it too. Einkorn is EINKORN. Spelt flour is one hybridization away from einkorn, so it's not bad either. Patients that are super inflamed when they come see us, we'll even hold that. We won't even let them do that initially. So almond flour and coconut flour, really good options too. Usually our pancakes and biscuits and blueberry muffins are made from coconut or almond flour. And there's a great cookbook called Against All Grains, and that's on our website. You can look on our website for that cookbook. And great recipes on there. But eventually, as you get well, you can move into the ancient grains, the ancient wheat. Yes, ma'am. Yep, same exact thing. Neo 40 is just the brand name for this supplement that's nitric oxide producing. The main ingredient in it, don't tell Dr. Brian, is beetroot powder. It's a whole lot cheaper. So beetroot powder, you can get it on Amazon or somewhere. Do a scoop of that. Non-GMO, yeah. Beetroot powder. But you know where it really is too is the greens. All the different greens, spinach and arugula and all the greens will really do it too. And here's the interesting thing about the nitric oxide, NO3. The nitrogen is fixed in the soil by the bacteria in the soil. Have to fix that nitrogen to NO3. The plants take up the NO3, put it into the leaf. We chew on the leaf, and our oral bacteria cleave off one of those oxygens. So now you got NO2 in your saliva, and it stores in your saliva. And for a long time, we didn't know why is that? Why does the NO2 store there? Every time you swallow saliva, NO2 goes to your stomach. The stomach acid cleaves the other oxygen off. Now you have NO, nitric oxide. The bugs in the soil put it to the plant puts it to the mouth, the bacteria in the mouth put it to the saliva, the stomach acid puts it to you. It all works together. You kill the bacteria in the soil, your plants don't have as much of it, and across the board, 1947, you could eat 1 bowl of spinach and get as much iron as it takes you now. In 1997, you have to eat 43 bowls, I believe it is, of spinach in 1997 to equal 1 bowl of spinach, the iron content. 23 apples, I think it is, to get the iron content. All the minerals, vitamins are depleted because the soil's depleted because the bugs are dead. So grow your own food is awesome, or find a farmer who grows food locally and get that, or when you can, organic, because if it's organic, it hadn't been sprayed, so there's a little more bug activity in that soil, so you have a little more nutrients in that. But if you pick it too early, you pick a tomato 10 days early when it's green, so when it ships across the country or the world to you, it'll be pretty still on your shelf. When you pick it a day before it's ripe enough to fall off the vine, that's when a lot of these nutrients are put in. So that's why locally grown, vine-ripened salvasterol, that's a phytochemical. Phytochemicals, phyto's plant, chemicals, chemical. So God put tons of chemicals in these plants. They're not vitamins, they're not minerals, they're just chemicals. There's 8,000 that we know of, and there's more than that we don't know of. A plant's worst nightmare is fungus and other critters. A plant doesn't have an immune system, and it can't run away. So the chemicals that are in it is what defends it. When we eat that, we get that benefit of anti-critter chemicals. But salvasterol is one of those. Salvasterol kills cancer cells. Salvasterol, S-A-L, salva, V-A, sterol, S-T-E-R-O-L. But salvasterol is not put into the berry and the vegetable until 24 to 48 hours before that's ripe enough to fall off the vine. So what I'm saying is your great-grandparents were salvasterol rich in their bloodstream. Today, salvasterol blood levels are non-existent. We don't have the phytochemicals because we're not eating vine-ripened.
Are green bananas still turned to nice yellow bananas under hydrogen sulfide chambers? Are that still the
Yes. As far as I know, yes. But a lot of the ripening agents are put on not just the bananas, but a lot of the different plants. And again, if you've got a real healthy gut microbiome and you're eating pretty good all week long, you have to go to the Mexican food place that doesn't have organic. I'm going to eat the salad and the whatever. But when I can control my food, I want to control that. I want to go to the farmer's market. I want to grow my own. I want to do whatever. But it's not about being perfect. There's some wiggle room for error there. But when you can, try to eat the right stuff. Yes, ma'am. Mm-hmm. Unfortunately, you have to just pull them. And the ligament that's underneath them, if you don't pull the ligament, the bacteria stay. Dr. Robert Menig, M-E-N-I-G or I-E-G, he invented the root canal in the early 1900s. He invented it. He was the founder, one of the founders of the American Endodontal Association. 5 years after founding that and inventing that, 5 years later, he came out and said, no, do not do it, stop, we're wrong. This is dead. He was taking root canal teeth out of patients with autoimmune and cancer and heart attacks and implanting those teeth under the skin of lab rats and seeing the same disease manifest in the lab animal of the patient it came out of. So he wrote a book called The Root Canal Cover-Up that goes over all the research and really goes into detail. So the biggest thing is get educated, because your dentist is not going to, if he were here tonight, he'd be raising his hand saying, I'm wrong. I mean, it's a huge controversial issue. But the only thing is you have to pull it. And go to the right dentist who understands this, can pull it, put ozone in it to kill all the bugs as best as possible, and then you either put a bridge or an implant. Dr. Elizabeth Dannenberg is a dentist who understands the connection between teeth and chronic disease. Or Richard Stanley in Marble Falls. Richard Stanley used to be in Big Spring, but he's in Marble Falls. And this guy's, he's a genius. He's like an artist. He's amazing. Dr. Danberg's excellent too. Super, super good.
You recommend probiotics?
Do I recommend probiotics? Yes, I do. I used to recommend them a lot more. Now I like to, they're good. There's nothing wrong with them. The problem with them is you're only getting a few strains, like 8 or 9 or 10 strains, and we need 30,000. So fermented foods have a lot more strains, a lot more variety, but a lot of people won't eat fermented food. That'd be sauerkraut, kimchi, kombucha, different fermented foods that you could find at a health food store. So probiotics, VSL number 3 is a good one. Probiotic 225 is a good one. Dr. O'Hara, Prescripticist, anything from Garden of Life is really good. Yes, ma'am. Well, what can you prevent or do for Alzheimer's dementia? Alzheimer's is like everything else, it's brain inflammation. So for prevention, don't be inflamed, meaning keep your gut healthy. That's the biggest preventative thing you can do. Number 2, eat lots of healthy fat. The brain's full of fat. It needs the fat. We've been told all these years that fat's bad for you. I didn't get into that tonight. Fat's not bad. Real butter instead of margarine. Coconut oil, olive oil, avocado oil instead of Crisco and canola oil, and soy and cottonseed. But you want the good healthy fats. The book Grain Brain by Dr. Perlmutter, he has a second book called Brain Maker, and he specifically addresses that, and he has diets and recipes on healthy foods for the brain, but mainly it's nourishing foods for the gut. The grains and sugars go way down, the healthy fats go way up, and the fermented foods go way up. Good gut bacteria. The second thing is the clean mouth. There's been associations between the root canals and Parkinson's, ALS, and Alzheimer's. Mercury from the silver fillings associated with neurotoxicity. We've known this from the 1800s. Mad Hatter's disease in England. The felt hats are being cleaned by mercury vapors. The guys are breathing it. They're getting neurological symptoms. Mad Hatters. We've known that for over 100 years. Mercury's toxic. The dentist says it's stable in the amalgam, but it's not. It comes out of the amalgam. The day it goes in, it's 65% mercury by weight. 5 years later, it's 23% mercury by weight. That much mercury comes out in 5 years. Every time you swallow the mercury, it affects your microbiome, gets into the bloodstream. The galvanic current, that's when you have two opposing metals with an acidic solution in between. That's a battery. It produces galvanic current. So mercury in a gold cap, and you got saliva that's acidic, that's a galvanic current produced, and that affects neuron and brain cell growth. So dental health is huge for prevention of various neurological things. So it's really, it's kind of simple. Keep your gut health good, keep your mouth health good, move around a little bit, eat real food. It's almost too simple to be. Yes, it can be, but that is a very hard one once neurological. All cells regenerate, all cells, but the nerve cells take a lot longer. And so it's a tough one. But if you can, if it's if you can get to it early and do some of these things aggressively, you can really prolong and improve quality. Prolong their symptom-free days and improve quality. But if they're kind of way down the road, it's a lot harder, really, because it's harder to control their diet, because they, might be picky eaters. But Grain Brain and Brain Maker is what I would say to do. Yes, ma'am. Acidophilus is good. That's a probiotic, pro-life, and I'm for that. It's good. Just what I don't want to give the impression that you can just take some probiotics or take some supplements and supplement your way to health, because you can't. You got to eat your way to health. And the probiotics are shown to not even colonize it. They don't really stay in your gut and make a lot more. They don't reproduce. They just pass through. But they're very anti-inflammatory. They hit the receptors in the gut that calm the immune system down. So that's really why they're beneficial. But I like the fermented food even better. But acidophilus is fine. Yes, ma'am. Chronic kidney disease. Dr. Circus, Sircus, Circus, has a lot of good stuff on his website about chronic kidney disease. A lot of times it's a blood flow issue. The vessels that feed the kidney are inflamed. You don't get good flow. But again, inflammation is the root of it. Sometimes it's an issue of a toxicity. I didn't really get into toxins too much. I mentioned the mercury from the teeth. But there can be toxin exposure that can damage kidney. And that stimulates the immune system too. So we kind of look at toxins. But usually it's inflammation, it's blood pressure, it's blood sugar, it's poor poor blood flow, the basic stuff, usually. If someone's further down the road with their kidney disease, we do special oxygen therapies, exercise with oxygen therapy. You get on a treadmill for 10 minutes while breathing pure oxygen, and it's kind of like hyperbaric effect. You get so much oxygen penetration through the lung into the blood. You're super saturating your cells with oxygen, and that can be very beneficial for later stage, all kinds of diseases, but kidney disease for sure. And there's some other kind of special therapies. There's some ozone is O3, 3 oxygen molecules. O2 is what you breathe. O3 is just a different form. And it's very medicinal. In Germany, they've been using ozone for 100 years. Every clinic in Germany has an ozone generator. There's only about 200 clinics in America that do it, and we're one of them. Very amazing therapy for some of these later stage diseases that we have to get real aggressive with. And that's one of them. Yes, ma'am. Glaucoma, macular degeneration, typically the patients that have those are later stage. Early on, it really responds well to the anti-inflammatory basic approach. Later stage, I usually refer to Dr. Jerry Tennant in Colleyville. This guy's a genius. He's an MD. He's about 78 years old. He invented the LASIK laser for LASIK eye surgery. He invented it. This guy's a brain. He's flying around the world teaching doctors how to do LASIK. He didn't realize it then, but when he was burning through the cornea, it was releasing viruses. He was breathing them in. He got viral encephalitis, itis, inflammation of the brain. His brain wasn't working. Chronic fatigue, memory loss. He couldn't get out of bed for 20 hours of the day he was in bed. He went to Harvard and everywhere to all the neurologists, and they said, yeah, you got viral encephalitis. We don't know what to do about it. He was forced. And that's the funny thing. All these doctors I learned from were sick themselves, were forced to go somewhere else, integrative alternative, and got better, and then, of course, flipped their practice to normal. And he's one of them. He reverses macular degeneration in 80% of the cases in 5 days. And he does it through energy medicine, where he's donating electrons, and that's a whole nother, the acupuncture meridians, Chinese medicine, energy. This is getting into the quantum physics, which American medicine doesn't even look at. Richard Nixon in 1970 went to China, and the reporter for the New York Post that was following him got appendicitis or something, had surgery in China. His anesthesia and his pain medicine after surgery was acupuncture. So in that moment, when the Western world opened their eyes to acupuncture, it's real. The acupuncture meridian system's real. It's all about quantum physics, energy, electron flow, and that's what Dr. Tennant's really specializes in, and I don't fully understand it. I've gone to one of his conferences, and I'm not a quantum physics kind of guy, and it was mostly over my head. But he's in Colleyville, and that's where we send people that have Tennant, Tennant, Jerry Tennant. TheTennantInstitute.com, I think, is his website. Just go the anti-inflammatory route. No, they're not bad. But it's kind of, it's like the medicine. The medicine will get your, like blood pressure medicine, gets the numbers down, and that can be okay, and gets your blood sugar down, that can be okay, but the root of it's still there, and therefore you'll still have all these potential things, like all the stats I mentioned before. So it's okay to use meds and use drops and treat the symptom, but while you're doing that, work on the root cause, bring your inflammation down, and you may not need to treat symptoms later. Any other questions? I know I probably went real late. It's 9:18. The dentist in Lubbock is Elizabeth Dannenberg, Dannenberg, Eberg. I'm not a good speller. All right. Well, thank you all again. Thank you, Heidi, for the invite. I'd love to come back sometime. We'll get into the other things. Yes, ma'am. Mm-hmm. Wow. Well, praise God.
So I'm saying, I'm just underlining everything Dr. Dan has said.
Well, thank you. And I always give credit to God, because obviously He's the one that got me on from the path I was on to, there's no way my flesh would have said no to all that life I was living. And He got me on this path, and it's His amazing design that's doing the work. We're not given any magic potions and special things. Just bring order to the body, and it fixes itself. So that's glory to God. That. Amen.
about that. In 74, I had kids to raise. I had been abandoned with them. I had to get well, and I just fell to my knees and said, Father, I'm not handling my life very well. Would you take over and see what you can do?
Amen.
And he led me to it. Everybody can do that.
Yep, you got it.
Lead you to the right place.
Yep. God has a great work planned for all of us, and so many of us are too sick in managing our sickness to be doing what God's called us to do.
God made it, and man hadn't messed with it.
You preach it, sister. All right. Thank y'all very much for having me. Thank you. Thank you.